2021. Ms. Hayes, will you please call roll?
Councilwoman Johnson. Present. Councilman Jones.
Here.
Councilman Smiley.
I'm here. Really?
Councilman Carlisle.
Present.
Councilwoman Swearingen. Present. And Chair Morgan.
Here. Do we have any members online, or just is it just members that are here? Okay. I'll go over. So this is a list that has grown. It looks like we have 17 presentations today. So just for time considerations, I want everybody to think about the 17 and just imagine if everyone took 10 minutes, and that's including questions. That's about 3 hours that we would be here. And I imagine some of these are going to take longer than 10 minutes, just in terms of the interest of questions. I see ShotRx first, and last time we had a lengthy conversation where we had 23 council members get in and out of the queue just for that one discussion. And we're just not going to be able to hear everybody today if that's the same case. So I say that to both the presenters and the council members to try to keep everything relevant to the ARPA funding, to your, to your request in how the ARPA funds would address an impact that's directly related to COVID. And also, council members, if we can stay on task as well, I think that would be helpful to everybody. I'm going to go in the order that I have them here, which is the order that they were confirmed to present. And the order is ShotRx, District 7 Grocery Store Initiative, Satellite Hub for Homelessness, Memphis Food Waste Project, Artist Emergency Fund, National Civil Rights Museum, Relationship Unleashed, Share the Pennies, Habitat's Aging in Place Program, Mid-South Food Bank, Downtown Memphis Commission, Explore Bike Share, Orpheum Memphis, Stax Museum, Southern Heritage Classic, African April, Baptist Hospital. So if you are an organization that's on the line and you realize that you're probably later in the queue, I would hang around, I would pay attention, but obviously it may take an hour or several hours to get all the way through these presentations. And depending on the stamina and endurance of council members, we may have to take a break during this as well. Okay. Some people are energized and ready to go. Council members? Ready to go. Fire up. Already, or any questions for you again, Councilman Johnson?
Question. Is this discussion, are we having particular discussions?
My hope discussions, this is a committee, so we don't have the authority to pass any resolutions anyway. We could only take votes on recommendations. If a council member were bringing a resolution, I don't intend to. And so I think, and again, the whole point of trying to hear from everybody is to not start voting on resolutions until we've had that opportunity. So, I'd kind of say in that regard, just everybody take a deep breath, let's listen, ask, and hopefully have questions answered, and even engage with these organizations offline. If you have really specific questions that you think are of interest to you, but maybe not to the entire council, please feel free to reach out to them in the coming days and weeks to coordinate and get together and get answers to your questions. And so this process can keep moving along.
So, Mr. Chair, we are giving positive or recommendations, or?
I know of no resolutions that have been offered for this committee, nor do I tend to offer any. Is that your intention?
I have a resolution.
Well, it can certainly be made by motion. There would then have to be a second. We can have a debate on that resolution, and it would be, again, a recommendation to the city council, which will convene again on October 5th. But this committee doesn't have the power to approve anything today in terms of allocations.
But you can send it down with a positive and negative recommendation to the council.
Yes, we could.
Okay, that's what I was asking.
Okay. All right. And so Councilman Logan is here as well. All right, we'll begin with the first up, ShotRx. If you will introduce yourself again for the record, introduce the team that is with you.
And prior to them coming forward, I'd like to pass out a resolution.
Okay.
With all my colleagues. All right today? I'm here. Also passing out a PowerPoint. And then, if I may have a.
If you want to lead off, go ahead, Councilman Swearingen, and then the floor is theirs to present.
And before we start this presentation, I would like to share with you all that I was able to take my booster yesterday. All you have to do is take your vaccination card to the Pipkin building Tuesday between the hours of 9 a.m. and 6 p.m., and they will give you your third shot.
Does it matter how long it's been since I've taken
it? It does not. I took mine in March, and they said, why are you here? I said, because I deal with children every day, or I'm around constituents, because I'm on the council or whatever, but you all do have the opportunity to take it. So just for FYI. Previously, there was a resolution that I proposed along with Councilwoman Johnson and Councilman Smiley, where we allocated $250,000 to SHOT RX for giving mobile vaccinations throughout the city. And that was contingent upon going through the grant with the administration of ELC for the remaining balance, but to just give them an initiative. Today, I'm sharing with you a substitute resolution to allocate $1 million from the American Rescue Plan Act to fund our SHOT RX Memphis vaccination initiative within the city of Memphis. And they will be partnering or in partnership with Bluff City Community Development Corporation. And this resolution, as we look at the last two lines, now therefore be it resolved that the Memphis City Council hereby allocates $1 million previously approved from the council initiatives to fund SHOT RX Memphis vaccination initiatives in partnership with Bluff City Community Development Corporation. Be it therefore resolved that this resolution shall substitute, supersede, and replace the resolution on the same subject adopted by the council on September 14th, 2021. And if you don't mind, Mr. Chair, I would like for them to introduce themselves, give their address for the records, and share the proposal that would substantiate them receiving this $1 million. And I appreciate your efforts in coming into Orange Mound this past Friday. They gave incentives. I don't know if you all are aware, but the city of Memphis, they give an incentive to all of their employees. They give them $250 to receive the shot and 2 vacation days. They had an initiative where they went into Orange Mound on Friday, and they offered the individuals $20 to take the shot. And we had more individuals to come on site to take that vaccine than they have had in any other community. They had 63 individuals to show up from the ages of 12 and above. We're seeing now that we are going to probably have to give initiatives to encourage individuals to take the shot. And today, I'm coming to you with a greater deal of passion that I did previously on the council day. Why? Because my aunt Barbara Swearingen Ware is in the hospital fighting for her life because of COVID, she and her husband. The doctors have shared with her they didn't think she was going to make it. So I'm coming here today with a greater degree of passion, and I'm discouraged because we couldn't talk her into taking the vaccination. Not taking the vaccination is taking us out of here. It's vital. So I'm coming to you today. I'm going to push harder than I did a week ago. Because you have to realize when you don't take the vaccination, it does not only affect you, it affects your family. To have to even undergo this. For them to call you and tell you she only has 70% breathing. So I would like for you to listen to this proposal. And you can say whatever you want. But I'm going to fight for this. I'm going to fight for people being vaccinated. And $1 million has nothing to do with a life. Your life is worth more than $1 million. We've gone from Delta to Lambda to Mu, and we don't know where we're going to go from here. So if you would, please introduce yourself and give your address and share with us your proposal via PowerPoint.
Yes, I'm Dr. Ted Lyons with ShotRx, and we are at 6084 Apple Tree Drive, number 10, Memphis, Tennessee, 38115.
Good afternoon. My name is Attorney Benicia Kimbrough, and I'm here on behalf of Love City CDC, who is in partnership with ShotRx to take this initiative into the community at a much greater pace and with far wider reach than originally planned.
If we go ahead and go to the next slide, the slides that you're going to see that begin with the ones that we showed you last time. You'll see that my wife and I, we started ShotRx back here in March of this year. Go ahead and go to the next slide. We decided to do this so that we can address the hesitancy that we knew would be in the community and also be able to give information to the people who need it most. One of the things that we kind of gloss over as a group of folks who have already been vaccinated and may already feel like it's important is that the communities we're going into, they don't know the importance of it. Some still believe that coronavirus is not real, but then also they don't understand the vaccinations themselves. So you have to be in the community and be able to explain to them exactly what's going on, why it's going on, and why it's important to get vaccinated. And you can't do this other than being there and having those conversations. And this is how we've been able to have good success. You can go to the next slide. And it just shows you some of the zip codes we've been to. We've pretty much been all over Memphis. Those are not all of them. Now, if you'll look at there's a spreadsheet that you were given that shows the events that we've done. Those are just the vaccination events. It doesn't even include the educational events, but you'll see that they span the whole city of Memphis and Shelby County. We've done additional, we have an additional 30 upcoming events. Well, actually more than that. It's actually about 3 per school with 30 charter schools, about 3 per school in those charter school systems. So even though it says we have 31 upcoming events, it's actually 30 different charter school systems with several events at each of those schools. You can go to the next slide. And this just tells you some of the success that we've had. Again, it's roughly been me and my wife, and we've been out here since March 24th, and we've given over 3,200 vaccinations. Over 104 tests have been given. We would have done more testing, but of course, as you all may not know, but the rapid test has been reallocated to the government, so we can't even receive any of the rapid tests anymore. They aren't so invasive. A lot of times in the communities, people don't want you doing the PCR testing that goes all the way up to your brain when you do it, but the rapid test allows you to do the test where you just get right inside the first inch of the nostrils. Well, we've had 2 wholesalers tell us that they've been reallocated. We won't be receiving any of those anytime soon. So we're going to have to start doing PCR testing, which again is more invasive, but at least it allows us to help out in the testing efforts that are going on out there as well. The way we get these types of results is that we educate and vaccinate. I just spent this morning with one of the charter schools, entire faculty of 200 faculty members and staff members, and we discussed coronavirus for an hour and a half. I thought I would be on the call for about 45 minutes. We went an hour and a half on that call with answering all the questions that still our teachers, our principals, our staff members in schools still have these questions. And if they still have these questions, you know their students and the students' parents have these questions as well. So as we debunked a lot of myths this morning, as we shared information this morning, we had a lot of those other 200 saying, yes, this is good information. Thank you. Now I can reconsider getting the vaccination. That particular school system has about 60% of their faculty vaccinated right now, and they're shooting for 70 or 80%. And they have some skewed numbers because one school has about 82%. So they really have some that are in the 40% range. They really want to get those up as well. That is what we do. We're going in and we're educating, then we're vaccinating. You don't have anyone else in the city that's doing that. There's no one else in the city that's taking the time to educate before they vaccinate. I don't care if they're on TV or anywhere else. If you're not spending the time having conversations where people can ask you a question, Dr. Lyons, A, B, C, and D, and you're able to answer them back, you're not getting them the information they need to make the decisions that they need to make. You can go ahead and go to the next slide. This was the high-level budget that I gave you all the last time, showing the staff that's needed, the equipment that's needed, and then the total cost. One of the things that I left out last time, because I was just trying to get you some numbers to help you understand how big this was. If you really look at what it takes, we're looking at over $1 million that would take for us to expand and then go into the community. If you look at the increase in insurance costs, because we'll have a mobile vaccine unit. If you look at the actual cost of the vaccination unit that we're planning on purchasing, those things add to those costs. But more importantly, we didn't include the incentives that we are going to start offering in certain communities. Incentives don't work everywhere. And I think that's a mistake that a lot of cities around the country are making. They try to do incentives and they're not seeing a good take-up of them. And it's because they don't work everywhere for your city, especially when you're talking about people just showing up. You have to go to particular communities and have particular community leaders offer those incentives. What we saw in Orange Mound is one of the reasons why we continue to say incentives work in certain areas. Because Reverend Tucker was the one offering, because it was in Orange Mound, because those people trust him, they were willing to say, okay, I'm gonna get off the fence now, go ahead and get vaccinated. And they accepted the $20. So we had 63 people in 2 hours show up. This again goes back to the point that I made to you all last time. We have to have more people on our staff to get this done. The only reason we were only there 2 hours because I was headed over to Hyde Park at 7 o'clock. So I was there from 5 to almost 7, and I had to be at Hyde Park at 7 o'clock to do a community event there. So we were there at Hyde Park from 7 to about 8:30, and we vaccinated some more people until it got too dark to vaccinate. So that's what it takes. And there's just nobody else out here doing that. But we need more people on our team so we can do that. More people that I can train, make sure they have the heart that we have for the people, and then we get out there and give them the information they need to make those decisions. If you go to the next slide, that brings us to another reason that we decided that we're going to partner with Bluff City Community Development Corporation. Bluff City has been here in the city, oh my God, for almost 7, 8 years now, since 2014, over $56 million in affordable housing projects that they've helped to develop. They're a contributor to the management of long-term care facilities. They're innovators, and they're in touch with the communities that we're trying to reach the most. They're in the disproportionately affected communities, and they know those community leaders. Some of those community leaders are tenants of theirs. Some of those community leaders work in the facilities that they have built there and managed there. So that's one of the reasons that we're partnering with them. You can go ahead and go to the next slide. And just some more about Bluff City. They are one of the oldest African-American organizations here in the city that are community-based and community development organizations. They take care of the whole person. Everything from housing to making sure that the kids have conflict resolution to even going in with the senior care homes and everything and helping to build, manage, and direct those. They have been a participator in the entire community, and that's what we're looking for because we're that type of participator in the community. So our partnership with them is one that we welcome. It's one that's going to help expand our reach into the most disproportionately affected areas of the city, and it's one that I hope you all will support.
Okay, thank you very much. Go to council members in the queue. Councilman Carlisle.
Thank you, Mr. Chair. Councilwoman Stranger, I'm very sorry to hear about your aunt and uncle. Certainly we'll be praying for them.
Thank you so much.
And I understand and I'm empathetic and sympathetic to the fight in front of us. But I also have a responsibility, whether people like to talk about it or not, to be responsible for, at the end of the day, with our taxpayer dollars. And this body was able to come together collectively and support and startup costs for you. and I'll just repeat, I've got a series of questions just based on what you're telling us. One, I'll just repeat what Dr. Jeff Warren said last time. I mean, I'm looking at your budget, and I'm just going to call it what it is. You're asking us to stand up your practice. You're asking us to stand up your business, payroll, business director, leasing an office space. Like, those aren't emergency COVID expenses. Those are long-term. We want you guys to stand up our practice. We started a business idea to help with COVID in March, and that's admirable, and I'm appreciative. But I'm not sure it's the responsibility of the Memphis City Council and these federal dollars to stand up a startup shot company like Shot Nurse or Shot RX or anything like that. And so I have a serious concern and some issues with the philosophy of doing that. Whether you're doing good work or not, again, it's very admirable what you're trying to do, but it's not necessarily our responsibility, and nor should we be using taxpayer dollars to fund a startup. I mean, you've got $42,000 for an office lease. You want us to pick up your insurance costs. You want us to pick up your billing and operations director. Like, those are business startup costs. I'm curious why you haven't put together a business plan and applied for, small business loans or gone to the Office of Business Diversity for the 800 initiative. Have you applied for any small business grants from the federal or state government? I mean, these are all things that would go through the ordinary course of business. And so I have a grave concern about that. The other thing, and by the way, I think it was great of this council to grant you $250,000, which is a significant, in my opinion, no strings attached opportunity to start working on your business plan. And so here you are yet again, back to go for this whole $1 million. I do have a question. So I had trouble after our meeting last week finding your 501c3 status. Have you guys applied? So are you pending?
Yes, and we have applied and we are pending.
Okay. When do you expect to have the approval from the IRS?
Right now, the IRS is not in-house, and that's what we were told from a number of the congressmen that are there who are trying to actually help us get this through because they also believe in what we're doing.
Okay. Because you're 6 months rolled out now. Okay, so you're still pending, waiting on your status. Tell me what your partnership with Bluff City CDC, what is their role in your ability to do your job, and why do you think you need that partnership now versus yesterday? And I don't need you to tell me about how great Bluff City is, because I'll get to them, because I don't know much about that organization, and I'll do my own homework. I'm having trouble finding a 990 since 2012 that they filed, and that 990 was for $1,000. So help me understand that.
Thank you so much,
Your name and
Councilman Carlisle, Attorney Benicia Kimbrough, and I sit on the board of Bluff City CDC. Okay. And I'm here to address the grave need that we find working in inner city apartment communities where a bulk of underserved seniors and children and single moms.
Ma'am, respectfully, I understand you. I need to know if you'll just tell me what y'all's, because we just got so many people, we got a lot of things to get
Absolutely. Our role is to expand the operation so that they reach those hardest hit areas. It is through our organization that the outreach will take place and that the guaranteed impact will happen. We can deliver the people who need the shots to Shot RX. That will be the role of Bluff City CDC, to make sure that we facilitate the education component, to make sure we do the community outreach and awareness component of it, and also to get bulk of people with our ties to several community groups in the community to get us events where there are numbers of people to increase the amount of vaccinations. So our organization has been in this community for years.
So will Shot RX be contracting with you?
No, it is strictly a grant funding. There is no funding outside of the administrative expenses relating to the accounting of the grant to be provided to Bluff City on the behalf of Shot RX. So we're basically an intermediary partner.
When you say the grant, are you talking about ARPA dollars?
That's correct.
So you're asking, so we're really talking about two. You're asking us to grant Shot RX money, and then they're going to give you a portion of that grant for administrative and accounting?
It is to administer the reporting that has to come back for the ARPA funding.
And what is the order of magnitude of that amount of money?
It's the minimum. I'd say $1,000.
Okay. $1,000 for the whole deal.
Yeah.
Okay. And will you do me a favor? If you're on the board, would you mind getting me your 990s your latest year 990s?
Absolutely.
Thank you. I appreciate
Absolutely.
that.
Can do that.
So, and that's helpful. Look, clearly I see, I guess it's Carl Mabry is the managing partner, has been around for a long time. I just, like I said, I looked up, couldn't find much information. As far as the incentive program, you know, I don't have an issue with doing incentives. I mean, it's kind of like carrot or stick. I don't think that we're to the stick, even though a lot of, you know, OSHA and organizations are moving that way. But I guess I'm not sure that the city council has to go through a third party necessarily to do just one kind of bucket of shot incentives. I know that we've tried some programs. Chief, you want to address some of the shot incentive programs
And I do understand you all have tried programs, and we've seen them, and we've seen the success and lack of success thereof of some of those programs. We are talking about reaching folks you cannot and have not reached. Okay, that is what we're talking about. We're talking about doing it a different way. And there's no one else out here doing it. There's no one else out here educating, vaccinating, going out there and getting this done. But the way to do incentives is to actually
with all due respect,
go out there and do it.
Sir, with all due respect, if I've asked a question to the chief operating officer, this body's been incredibly respectful of your time and allowed you 2 separate meetings to address the body. And we're talking about $1 million. You know, we're just trying to get brass tacks here. And I appreciate your opinion in the matter. And I genuinely appreciate the work that you guys are attempting to do. But it's a far cry for us to want to fund shots and out in the community and standing up a full business plan. And to be frankly honest with you, you know, I think the fire department and a lot of people that have been working vaccines would take issue on the efforts that have been made here. So I'd like to hear from the chief operating officer on some of those.
Thank you, sir. Doug McGowan, Chief Operating Officer for the City of Memphis. 347 Stonewall. Specifically to the incentives, one of the incentives was the award through business community of a $30,000 vehicle that resulted in 15,000 unique signups and 15,000 unique people seeking a vaccination. City of Memphis funded $100,000 of $50 Kroger cards, resulting in 2,000 unique people coming to get a vaccination during the vaccination surge at the Pipkin building. To your point on, with respect, no one else doing this. My healthcare navigators are doing it today, and actually $160,000 of gift cards. Healthcare navigators have done more than 12,000 vaccinations to this point. First Pharmacy is doing community-based pop-ups all across the city. Methodist LeBonner Healthcare, and we've sponsored more than 100 church-based vaccinations in the community. So I understand and agree and 100% support doing increased vaccinations, but I do just want to get the facts out that there are other people doing it. We welcome people being added to the list of people that are doing it, but it's not the only people that are doing it.
Thank you, Chief. I'll say this again. I think $250,000 is more than a reasonable, but not to mention that all of the vaccinations can still receive reimbursement from the city, and that the city is still probably well positioned in velocity. While it's important to have different modes like First Pharmacy and others out there, and that's what we're open, and I think this body's open to doing, I don't know that we can be in the let's stand up a business. And again, I know that's a hard thing to say, but sometimes you have to be willing to say no. You know, you need to go and take this bucket of money and match it with others in order to stand up the business. So I could dive in a lot deeper, but I know others probably have some comments. And with that, I'll yield the floor.
Thank you, Councilman Carlisle. Question about the presentation. 8 days ago, y'all requested, I believe it was about 904,000, and now it's 1,053,000. Why the increase of 150,000 over the last 8 days?
Right. When I was going through, I explained to you that we left some things out of the first one. One was the full cost of that vehicle that we were going to do for a mobile unit, sort of like you just mentioned that the city already has or someone already has. We were going to do a similar type vehicle, and the cost that we had on that was not included in that, and then also the cost of incentives, which we didn't put in there in the first presentation. They weren't in there as well.
Okay. And the other question to 8 days ago, to the 250,000 y'all got, as well as the commitment from the administration to work on, I believe, was it ECL or ELC?
ELC.
ELC grants. Why is that not sufficient? Because that's 3 months, you know, as presented last time, it was more than 3 months business operations to get things going. And then because of just the nature of the business, where you provide services and you're reimbursed at a later time, why wouldn't that be enough to start and then sustain you?
If what was said here in council was what was said when we got out of council and began talking about this, then that would have been a possible way of doing this. That was not what happened, okay? And this is the second time that I've been in a conversation with the city of Memphis, and I was told one thing because I talked with them back in March, and we were told that we would be receiving A, B, C, and D, and it did not happen. I was okay with that and continued doing what we were doing. We're still going to serve the community. We're still going to help. And all that they were saying then is that they're going to give us a list of places they couldn't go. Did not get that. Have several emails to that fact. So I was jilted once. And then we turn around this time and we have a conversation and we start having a conversation outside of you all's presence. That then changes to not you're going to get paid for every shot that you do. It'll only be when we call you. Well, you haven't called me since March, so that doesn't work. That's not going to be something that I can count on, I can believe in.
What was the main pressure point in terms of the contract negotiations that didn't work out?
That was it.
Okay. Well, I think you're going to have a pretty difficult roadblock because we can allocate and appropriate money here at the city council, but we don't write or sign contracts. That falls in the purview of administration. If you're unable to work with the administration in a functionable fashion, you're going to have a real tough time here. And we have done this through hundreds of organizations, through our grants process, all across the city. Different organizations have been able to manage and work their way through it, serving all sorts of different purposes. So this is the first I heard of an organization, I guess, essentially it's been approved by the council, then fallen through twice when it comes to working with administration. All right, I've got a few more questions, but let's go to the queue. Councilman Johnson.
Thank you, Chair, for the opportunity. I think some of my questions may have to be addressed by Chief McGowan if he wouldn't mind returning. Yeah. I'm confused at this point. I am truly confused because I was under the impression, too, that Shot X would be able to go to the administration and actually get the additional funding to start that. That's my first question. Let's see if I can get some clarity on that. My second question is, you told us, too, Chief, that you had approximately $7 million left to spend, if I was correct. Okay, how long do you have to spend that $7 million? Okay, and I got third questions. I got questions today, I'm sorry.
Ready.
I'm just sitting here thinking, the third question is, how effective has it been so far with the money that you've already spent on giving out shots? Because based on the numbers that I'm hearing, we're still pretty far behind in regards to the population and who still needs to receive the shots. So I just, I understand there's some difficulties and confusion in this particular arrangement, but we're going to have to do something different in some situations to reach those. Just as Councilwoman Swearengin just said this morning, her family is experiencing that. I'm talking about people that we would have surely thought would have embraced the vaccination, but they didn't. I have family members who are not taking the shot. And it creates total chaos once COVID gets into the family. I mean, total chaos. People don't want to go visit with each other. We're having a conversation. We're arguing with each other about not coming over people's houses. It's horrible. So, there's a reason why some people are not taking it. And it may be more of a counseling that your organization may need to be reaching out and working with rather than shots or something. But, I'm talking about people who have jobs, going to jobs every day. We say, you need a shot. And they won't even let their mother get vaccinated because they don't want to be vaccinated. So we have a serious issue here. And I would love to see the community, more people get vaccinated. I don't know what else to say. I'm not informed enough, and I need some expert help encouraging these individuals to get vaccinated. So I understand confusion and what's not happening, but we're going to have one unique approach. And I think you may have that answer. It may not be clear. People may not see it. You know, maybe we need to hammer it out some more, but we're going to have to do something to get deep into the community that we're dealing with. Thank you, Chair, for the opportunity.
Thank you, Councilman. Any other council members in the queue?
Did you want me to
Councilman
answer any of
Jones?
those questions?
Or, oh yeah, there were 3 questions asked, please. Chief McGowan, then Councilman Jones.
Answering one question, yes, we received a $15 million ELC grant. We also received some CARES Act money. There is about a little over $7 million left in that ELC grant. To the point about effectiveness, we have delivered, my phone screen died, but we're more than 900,000 vaccines have been delivered in Shelby County. That is 110,000 more vaccines that have been delivered in any other county in the state of Tennessee. Now, we are the most populous, but 53% of our people have received at least one, 43% have received at least 2. That is about the state norm, but yes, we are behind other states. I will also tell you that in the month of January and February, before the city took over, we got behind. As you know, there was a shift to giving vaccines over to the city to take the lead on. We immediately accelerated and, as you know, had the opportunity to deliver a significant number of vaccines, including doing 50,000 a week when we had invited, and we actually had the Department of Defense come here. Unfortunately, we only had an uptake of about 5,000 a week at that time. The demand dropped off. So I'm proud of the work that we have done. We have been in North Memphis, in the Raleigh area, in South Memphis, in Whitehaven. We've been in East Memphis. We've been in Germantown. We've been in the Pitkin building. We've had drive-through sites at Appling Farms. We've had drive-through centers. We've had remote pop-up, more than 100 events in partnership with churches. We have 2 mobile vaccination vans that have been on the streets with our healthcare navigators. We have called now 80,000 people on the phone. We have now knocked on about 30,000 doors in zip codes where there's low uptake. We have paid Rhodes College students, University of Memphis students, to go on foot to neighborhoods. We have offered vaccines on demand. Quite frankly, other cities in the state are calling to say, what else tell us what y'all are doing so we can copy what you're doing. We are on the leading edge of doing everything that we can. None of that has anything to do with minimizing the work that ShotRx is going to do, because they have a role to play, certainly. But we have been effective with the money that we have. And if there are any other ideas that people have, I welcome those, but we haven't had any necessarily come forward. On the second point, also the other piece is that we have offered on testing. We were leading in the nation on testing. We were the first community to have broad-ranging asymptomatic pod testing and pool testing, because we have 2 laboratories here that are well versed in that, and other people have learned from us on that. We did vaccinations with school teachers and testing with schools and with employers. To the point about the ELC grant, it was 1 week ago that ShotRx was granted the $250,000. And I just want to be clear, whether or if we were able, I'm not sure who the doctor talked to. He may have talked to Tiffany, but how this typically works and has worked with University Clinical Health, Allied Healthcare, Christ Community, and Poplar Healthcare, and probably 5 other providers, are that they provide us with a scope of work, and we work out a basic agreement with them that says, in exchange for your services, we will provide you this level of funding. I have not seen a scope of work yet. The example, just to be frank, was, when do I get the other $750,000? That's not how it works. That's not how it works. It's a fee for service, and you provide the service, and we reimburse you for the service of the ELC grant. I stand here today, still ready to work with you, to provide a scope of work for me, and I'm happy to engage in that. But it won't be an open-ended commitment of a certain finite amount of money. It will be a per service that you deliver. That's how it works. That's what I do with Poplar Healthcare. That's what I do with University Clinical Health. That's what I do with everybody else through the ELC grant, because I have to get audited on what I pay for as well. I'm happy to do that.
Mr. Chair, I think we have gone outside of, the scope of this resolution. This resolution is to substitute, supersede, and replace the previous resolution asking for the $1 million to come to ARPA. We're no longer discussing ELC.
Well, ELC was an option that was presented 8 days
And
ago.
I understand that, and that's why I rescinded it.
You do not have the authority to rescind something that the council has already
I rescinded
passed.
my resolution. I can substitute.
You can introduce a new resolution,
Okay,
but
and
once
this
it goes to the
resolution-
council and is passed, it is the body's resolution rather than individual council members.
Well, I want to, go through another route. And this resolution does that.
Okay, and also, I think the conversation has been on topic as to the validity of.
I'm not finished talking.
Point of order, Mr. Chair, I believe that Councilman Johnson is correct.
Okay, well, Councilman Carlisle is correct. We have a queue. You've requested to be back in the queue, and we'll come back to it. But I do think we have gone over time. We certainly can't commit this amount of much time to each, but there's still significant interest from council members, so we will go back to the queue. Councilwoman Johnson, does that conclude?
That concludes me. Thank you for the opportunity.
Okay. Councilman Jones, then Warren, then Swearingen.
Thank you, Mr. Chairman. I was just trying to get some clarity in an update verse from what transpired at our last meeting and this. So are we talking 250 plus another 1 million? Are we talking taking the 250 off? We're just talking about $1 million. So that was my first question. Get some clarity about that.
Right. Erasing the 250 and just going with this new resolution.
Okay. And so when we look at this new resolution, is any of this coming from, what is it, ELC, ECL? So all of it will be coming from ARPA. Okay. You know, despite all of our efforts, what we've done, according to the Shelby County Health Department, as of last Friday, we were still at 51.4% of the people who've received at least one dose, and just 42% of the people in Shelby County that are fully vaccinated. So I would contend that whatever we've done, we need to do more, because we're nowhere near where we need to be. Whether we talk about healthcare navigators, whether we talk about roads, whether we talk about Christ community, everybody, it still has us where we are right now. And so when I'm looking at the total scope, this is a business opportunity, because a pandemic, no one envisioned a pandemic 2 years ago. So with what are new circumstances, new challenges, to me, 42.6% of the population totally vaccinated, we need all hands on deck. Whether it's, if 13 council members, if all of us need to start a business, you know, to get more people vaccinated, we should do that too. But, you know, to say that if there's anybody else that want to come to council to address this issue, I would say they do it as well. But we still are talking about what has been funds, whether we talk about ARPA, whether we talk about CARES. We still need to address this pandemic and get people vaccinated by any means necessary. Thank you, Mr. Chairman.
Thank you. Councilman Warren.
Thank you, Mr. Chair. I think my issue here, and I think it should be our issue, is if we have funding that can do this and we can use our ARPA funds somewhere else. We offered $250,000 for a startup fee, and I think it's reasonable for anyone who's doing medical care to get paid like everyone else does who does medical care. So far, out of the number of vaccinations that have been given in the city, he's given, I believe, in his group, 0.6% of all the vaccinations in the city. We've given out 482,000 vaccinations. I think he said 3,200 vaccinations, if I remember correctly, last visit. So if we're going to spend $1 million, you know, I think there are other places that we can use it, particularly when we've given him the startup funds to get his business up and going, and we've given him a way to continue to have funds to make this continue to occur. I think it makes good sense for us to allow him to go for the funds that have been designated for medical care, and let's use these other funds for other issues that we have in the city. So I would be voting against expanding this, and I think that there are other ways that he can get to the funding that he needs. I think we should allow that to occur. Thank you, Mr. Chair.
Thank you. Councilman Smiley?
I don't have anything to say. I just want to call the question.
Okay, we still have Councilman Swearingen and myself in the queue, and then Councilman Robinson as well, and Logan. So it sounds like we have an objection to that call of the question. All right. But I will close the queue after that. Okay. Councilman Swearingen?
Yes, Mr. Chair. I would like to call for the vote for this to go down with a positive recommendation to substitute, supersede, and replace the resolution that was adopted by the council on September 14, 2021, so that $1 million will be allocated to SHOT RX in partnership with Bluff City Community Development Corporation, who have their 501c3 status, and they will be working in partnership. But I would like to call for the question for this to go down for the positive recommendation.
You've got council members in the queue who would like to be heard on this issue. Do you not wish to hear them?
I would certainly would not. I want to be fair to everybody. I certainly don't want to hear from them.
Okay, so we're going to cut off the queue, but we're still Robinson, Logan.
Sure, we're going to call on Chief of Staff Hyman to explain essentially, I guess, the essence of what Councilwoman Swearingen is attempting to do, because there's some confusion on this end. Yeah, no, and that was going to be part of my questions as well.
She's increasing it $750,000 to $4 million.
Okay, that's not the resolution we have in front of us.
The resolution will.
Okay, that's the question, because what we have in front of us isn't valid. Something else is being reprinted. Okay, right.
It's just a new resolution, but the last.
While we wait on that printing, and then there will, I'm assume, be a motion on that. Let's go ahead to Robinson.
Thank you, Mr. Chair. I just need some clarification. So the grants that we're doing now, they do not have to meet the standards of the other council grants? Is that what we're saying this evening? Thank you.
It's up to the majority will of the body.
I had a question.
Could you repeat the question?
My question, we have been doing council grants. Are we doing something different this time in the requirements for council grants? And Mr. Chair, you ought to be able to answer.
The requirement is a bit of a trick word because there are no requirements other than the federal and Tennessee law. So it is up to the will of the body what guidelines we have used in the past for city council grant programs and how we administer these ARPA funds. And that is always subject to being changed at every single vote by the will of the body. We have not established any guidelines or had any resolution to establish guidelines for how we will distribute the $20 million of council initiatives. So if a council member would like to introduce that, that is certainly going to be up for debate. We don't have anything in front of us. The docket's pretty full today. It was not my intention to vote on anything today. I don't intend to vote for this. Or at the very least, maybe other council members might want to hold it if they don't want to vote no on it or yes on it today. But that is something that we can certainly have a discussion in the next budget committee on October 5th about guidelines.
So then my second question, because I don't want the community to be disenfranchised. I want them to always know what we're doing and why we're doing what we're doing. That's a little confusing to the other participants in our grant program. But the biggest issue here for me is that we need to have as many people vaccinated as possible. And I'm sure that the administration can tell us how many more we need, how many people on the ground, where they need to be. But it should be a per ratio, some kind of ratio that we have involved in this rather than the whole operation. We need to know, what does it cost to give one shot? And how many are we willing to pay for? And it should be in relationship to how much we pay the other organizations as well. How much are we paying them to give shots? We don't want to give anybody, be unfair in the way that we distribute dollars, that one organization is getting paid $50 a shot, another organization $100 a shot, and another somebody else $150. I think for the citizens of Memphis and for our taxpayers, council members, we need to be cognizant of the fact that whatever we're doing is to help get more shots out there. My God, I know we need more shots. We need people administering them, but we need a process in place. But this is how much we're going to spend per shot, from $10 to $20, whatever it is. And if you want to participate, you can. But I don't think this is the way to get to where we want to go, is just looking at their total expenses. Is what we determine should be the amount, and the administration would have to help us with that we should be paying per shot, so that we can get more people the vaccinations that they need.
The employees get $250
per shot. Okay, so we need to, that needs to be a conversation here, because we can't pay one organization more than another. To me, there should be some
and that $250 is an employer. Is an employer-employee relationship.
Okay.
We don't pay
We're giving them
a shot giver $250. We pay the individual that received the shot $250 if they're an employee of the city of Memphis.
Okay.
That's what it costs to give the shot.
Okay, I'm just talking about, what does it cost to give the shot? And we need to have that conversation.
Okay.
Okay. And Dr. Warren just showed me the federal rate is $40 a shot.
Okay. Councilman Logan.
Thank you, Chair. The question that I had, well, two questions. One is just clarifying, are we voting today, or are we listening to everyone and then voting? Because I want to make sure we're not voting and then the money is spent and we haven't even gotten through. That was the reason for having
Correct.
this
I don't want to vote on any of these today, but a colleague of ours has introduced a resolution and is going to make a motion on it. We have yet to have a second on that resolution. We do not have to take any action on this if we choose not to as a body. But I cannot stop a colleague from making a valid motion when committee is open.
Okay, thank you. And the second question is, I just wanted clarity on how many vaccinations will be able to be administered with this funding.
So as we stated last time, our goal is to get to 20 or 30,000 vaccinations.
And with this funding, you'll be able to vaccinate 20 to 30,000 people.
That is our goal.
Okay. I yield back, Chair. Thank you.
Okay, thank you. What is the business model for ShotRx if, thank God we get beyond COVID?
We're involved in all the disproportionately affected communities and actually taking care of the whole person. So we'll also be doing everything from hypertension, diabetes, everything that is to go on with a person. We do it all, So that's
B12 shots.
So again,
B12 shots, testosterone.
Yeah, we do. Yeah,
no.
We won't be doing those. We'll be doing B12. We already do B12 shots, flu shots, all this. Vaccinations now, and our total model includes actually taking care of the whole person, everything from acute adult care to also well child visits, all of those things. That's down the road for us.
And schools.
So again,
And schools.
yes, all that. Yes.
And so that goes to the point that Councilman Warren made, and it's been this haunting comment for the last 8 days in the back of my mind, that we are essentially paying you, and it's again to Carlisle's point, for the back office, building your business that will go beyond COVID. I wish you all the success in the world. I hope you vaccinate as many people as are willing and able in Shelby County. But I don't, and we will reimburse you for shots that y'all give, but I don't know about paying for the staff and paying for the office and paying for the vehicles and essentially taking a year of your overhead costs onto our books. And then at the end of this, you've got yourself a profitable business that's running, and it may have nothing to do with COVID. So that's troublesome, and I'm beginning to regret the vote that I made on this 8 days ago, especially because I felt misled that y'all already had a nonprofit that had been approved, and that's what we were going towards, the ShotRx Memphis versus ShotRx. And I think there's still some murkiness about that relationship between the two organizations. As I've said already, I do not wish to take any votes today on any of the organizations we're hearing. We have a colleague that has made a motion on this. We have a new resolution. So Councilman Swearingen, you're making a motion.
I'm making a motion to send this resolution that will supersede and replace the resolution that we adopted on the council September the 14th, 2021 for ShotRx Memphis and the Bluff City in partnership to receive $1 million through ARPA funding. I'd like to call for the question to send this down with a positive recommendation.
Is there a second on that motion?
I second it.
Okay, so it's been moved by Councilman Swearingen, second by Smiley. Let's go to a roll call vote on that motion. Again, this is a recommendation that will go to the full council on the October 5th meeting. Ms. Hayes, will you please do a roll call vote?
Councilman Smiley. Councilwoman Johnson. Councilman Ford. Councilwoman Logan. Councilman Jones. Councilman Carlisle.
No.
Councilwoman Robinson.
No.
Councilman Warren.
No.
Councilwoman Easter Thomas.
Yes.
Councilwoman Swearingen.
Aye.
And Chair Morgan.
No. A vote of 7-4. The ayes have it. This will receive a positive recommendation and will be on our agenda for the October 5th meeting.
Mr. Chair, I'd like to make another motion that we add to this resolution how many vaccinations we expect over time. You got to have some. There is no way to measure anything. We're just giving them $1 million for how many. We got to have some measurable objective.
Come on, we're here to stand your business out. We're here to take federal taxpayer dollars.
Councilman Carlisle.
We've got to have some measurement.
I agree with that.
Councilwoman.
And I think amendments would be very much in order on October 5th. Let's get it in writing. Let's put some thought and organization into it about any potential contract language or that we would request of the administration. I don't think we can dictate it, but we can request it. Okay. Thank you. All right, so that took 65 minutes. We have 16 left. Let's go to District 7 Grocery Store Initiative, Councilman Easter Thomas.
Good afternoon, colleagues. Mr. Whitney, and good afternoon, Chair. Mr. Whitney is passing out to a lot of commotion. Okay. So Mr. Whitney is passing out 2 items for you all as well. And Mr. Whitney, if you would like to pass one to Chief McGowan as well, I'm sure he'd like that. So just initially, when this was brought up as an proposal for ARPA funding, I think that we all shared knowledge of the need that we see in one of our Memphis communities, and not looking at it from a district perspective or whose neighborhood, but just seeing one of our communities that are dire and without, and seeing the specifications on which ARPA funding can be spent. This is a wonderful opportunity and moment in history that we have as a council and as a city and as a government to make an investment that will span generations, tangibly, quickly, for those in dire need in the North Memphis area. You have two documents with you. One is a stapled document and the other is the resolution. But if you look towards the stapled document, I will say that in March 2020, before the pandemic, there were conversations being started amongst a group of Memphians who do this work in getting groceries into food deserts in our city. And we were sitting and trying to figure out how can we get resources to this area. Fast forward, COVID exacerbated a lot of the issues and the needs that we've seen and that we've all worked towards trying to eradicate across our different communities. Now, as we see an option to speed up and support what the private sector cannot do alone, through a public investment and also partnership with Promise Development Corporation in order to have a resource center in this area of the city, with the main priority being a grocer available for the neighbors in this area. As you see in the write-up and also the tentative budget, a developer, a nonprofit developer, also minority, led by African American, Cornelius Sanders, has been identified and is also willing and excited to work on this project with us. Also, there is commission support, partisan, might I add. They have not went to votes yet, but they are waiting on our initial support as well. If you also look with the USDA provided image on where our food deserts are in our city, as you see on this map, green is not a good thing, and no apples are not a good thing. For our citizens that are listening in, USDA map outline where there is lack of groceries and lack of transportation, and that's the map that I'm referencing. So colleagues, as you look through this presentation, it is our initial proposal, but that of course would be able to be flushed through with initial support to ensure that we have a knowing government consultant on hand to be able to develop this plan efficiently, and also our architectural. Now, I will say that I'm not going to say the area of the neighborhood online because, as we know, with location scouts, but there are 4 areas that have been designated. And so those have all been estimated in the cost with land acquisition and demolition. Market study was previously done in 2020. And at that time, it included the Save-A-Lot in Binghamton. Since then, as we all know, the Save-A-Lot has also closed in Binghamton and the surrounding communities. So this is not just being for North Memphis, but also for the surrounding communities as well. And I would like to take any questions as you all peruse through this proposal.
Thank you, Councilwoman. Just since we were on the topic of building businesses, so
not building a business.
Right. How would well, most grocery stores are for-profits that we look around at. So who is the owner operator of the grocery store? Or are we yet to find a tenant?
So we are working with Mr. Massey.
How do you
I'm not sure
envision
if
the $3 million being spent, and then who takes control? Is it all for services, or is it, like you say, for land and buildings and things like that, and then another entity will take control of that?
Correct. So the $3 million will not fund it indefinitely. We don't want it to be a full City of Memphis funding project. We want to give our county commission and also other entities opportunities to be a part of what this is going to be is a monumental investment. And so it's not a grocery store by itself. We have a lot of needs and asks for resources that people just don't have access to in these neighborhoods, or in this neighborhood in particular, in the surrounding communities. So including not just the grocery store, but we've been in talk with multiple individuals on the possibility of having an office or satellite office there, community resources, pharmacy, financial institution, employment center. Also have been talking with mental health counselors. So not just food as the resource needed, but we're really looking at the holistic Memphian and what can be provided and also what can be attracted to have here for these individuals. So as you see on the, I don't have a copy of my own stuff, but as you see on the outline, we gave them all to y'all. You have on there land acquisition and demolishment, architectural fees, which we have identified 2 minority possibilities for architects. Also, as well as the pre-development costs that will be needed, contingency, which I also learned, which my developers will know what contingency is. I also learned what that is in this process. As we've seen, costs would go up from what those estimates would be, lumber, steel, what have you. Developer fee, admin fee, our construction costs, but also following in the footsteps of Councilwoman Swearinger isn't here, but with the effort to get the grocery store on Lamar going. What that instituted was a grocer stabilization loan in which it was not given to the private sector business, but it was loaned to them for startup costs, remediation, development, and so they could actually get into that deserving and low-income community. And so basing off of that, which was a success, the store is open and thriving. It's a cash saver there. Hopefully doing the same thing with this effort as well. So incentivizing the private sector to come and couple with nonprofit and public resources in order to have what's needed available for the folks in the community.
Go to the queue, Councilman Carlisle.
Council, I'll yield the floor to the senior statesman, Councilman Ford, if you'd like.
Councilman Ford.
Yeah, what she's talking about.
Use the microphone, please, sir.
Yeah, go back to some little history. Started at Southgate Shopping Center. Then it went over there on Lamar, to the shopping center there. Kroger kind of dogged us out, okay? We had no stores. So we had to do quite a few different things, okay? To try to get those stores, and not only just a store, but there's pharmacies for everybody and things like that. That's what she's trying to say that it's needed out north. We don't have any of that out there anymore, okay? But it all started with Kroger, okay? I wish we could find somewhere for Publix to come here, to give them some competition. All they need is a distribution place. Doug, help me find somewhere.
No problem.
Okay, reasons why I'm saying that. You got Kroger as a monopoly now. Okay? All right. They went into a black area. It's a black thing now. They moved, which was not good. Southgate Shopping Center, that particular area had Southgate, which all of Southgate was just about. But you know, they made more money. We did a study. They made more money there than they made out on Poplar Avenue, where they got every block you got a Kroger. Okay, reasons why they end up doing that, a lot of y'all may not know why, but the reason why is the Union store that they have. They wanted all of us to come down on Union. We wasn't gonna do that, okay? If you go on the Union store, they got the little bitty baskets, okay? Because people are gonna end up buying a little meat here, a little salad here, little salad there. But when you come to our area, we got 2 or 3 baskets. We spending money, but they wanted us to come on Union. That's why I said, Doug, please find us somewhere for Publix to come in here, because they figure they got the competition. They don't want to come to a black area. I have a problem with that, because we spend quite a bit of money. Maybe we need to quit going to Kroger, all black folk, okay? And then maybe they'll learn. You know, out in Whitehaven, they wanted to close that particular store until I made them do a study. They found out that, hey, Whitehaven, you know, we better stay here. We better make things kind of nice. So, Councilwoman Thomas, yeah, we need whatever we can to try to bring something out there in North Memphis, okay, in that particular area. You know, we don't even have banks out there. Used to. We don't have any of that, but what you're trying to do will bring all these different things to this particular area. But like I said, hey, and you know, you got Save-A-Lot and all the rest, that's all right. But, you know, we need something worthwhile. You know, we like good food. We do spend a little money. You know, if I got $100 in my pocket and if I want it, hey, I'm going to pull out my card and spend it. But now some other folks don't. They'll go down there to Walmart. I don't like Walmart food. I'm just being honest. Not especially me. Save-A-Lot, I don't like theirs too much either, but if we have to deal with Save-A-Lot for a while, I mean, hey, we have to do that. I mean, I'm just being honest with you. I agree with you. You know, the quality of everything. You know, I'm gonna give y'all another typical example. Macy's. Hell, they left Whitehaven. But you know what? Everything that they couldn't sell at all their other stores, East and everything else, they sent it to Whitehaven. We didn't want that.
Amen.
You know, we didn't want that. We had to go with everybody else in order to get what we wanted. But when you went to South of the Mall at Macy's, hey, I had no problem them leaving. Because what they tried to put on us, we did not want. Okay? But this is something worthwhile money. Hey, in that particular area needs it, and I'm going to be quiet, but I mean, hey, whatever it costs, hey, and maybe we can get county and all these other people to kind of help, but hey, we need to really kind of put all those things out there. But Doug, I'm very serious. Please find us distribution, because that's all that they want in order to come. But once we give them some competition, because see, Save-A-Lot ain't no competition. None of those other stores are competition. They got and they figure they can give you whatever you want. And I'm going to say one more thing. And I'm going to be quiet the rest of the day. I'm not a prejudiced person. I don't like prejudiced people. Okay? I was named after two of the worst prejudiced folk in the world, E.H. Crump and Cordell Hull, that didn't like black folk. But every time you had big stars, you had all of that, black folks own these stores. You had Malone and Hyde, racist. Okay? That's kind of where Kroger feel. They got the monopoly on everything. Black folks had to, really went out of business because Malone and Hyde, hey, they would sell Kroger 4 cans of vegetables for $1, maybe. I'm just using that as a number. But when it came to the black grocery stores that we used to have, Chisholm Trail, all of them, you don't see them anymore. When they start growing, Malone and Hyde, hey, said, I will sell you those same 4 cans for 3 times more. What does that do with us? What does that do with us? It kind of put us out of business, don't it? They did that with grocery stores. They did that with gas stations. They did that with a lot of different things. And people forgot. If you got it, everybody will make something. You know, everybody. Chase, you got plenty of money. Invest. Chair, you too. Hey, invest in, hey, and I guarantee you, hey, get some of your folks to invest in, hey, they won't be going wrong. You know, put the money there, and I guarantee you, within a year's time, you say, I should have done it years and years and years ago. That's what we need to kind of do, because, hey, we do like very nice things. We spend a lot of money. And if you go out to the Wolf Chase, if black folks didn't go to Wolf Chase for a month, they will lock it up. Okay, see what we do. So everybody that's listening, whatever, hey, invest. Go out there in North Memphis, all these other places, put that money where, hey, it can be used, and I guarantee you, you know, just like banks and all the rest of it, hey, we don't mind putting money in the bank. Thank you.
Thank you, Councilman Ford.
All right, thank you. Councilman Carlisle?
Thank you, and thank you for those comments and dragging me in the middle of it. I've told Councilwoman Thomas this, and I've said on the record, I'm very supportive of that. This idea, and in particular, these funds, like, we have spent so much time talking about certain things till we're blue in the face, and so this is a concrete step to address an actual issue that could create a legacy. And it's unfortunate what's happened at the Gateway Center, but by investing in the broad Binghamton Gateway, there is still a physical structure there that junior achievement is now moving into. And so I'm on board with this, and I actually even appreciate kind of how the resolution's written, which is to capitalize almost like a cover line. Hey, we're going to earmark this $3 million, and we're going to work through the details, because there are things I'd like to meet the developer, because there are some things on here that I've got questions, and if they're listening, I'll just tell you one specific thing. It is out of market to have a 7.3% developer fee. It's out of market to have a 7.3% contingency fee. Those are out of market. You wouldn't do that for any other project. So I'm supportive of this, and I'm going to vote in support of this. But I'm hoping that, and if, Councilman Thomas, can I get that market study if they've got a copy? I'd love just to read it.
Yeah, Mr. Whitney or Devin can send it out.
I think I'm very curious to read that information. So I'm going to support this, especially as an earmark. And my hope is that ultimately we don't need all $3 million for this one store, that we can find other sources like the county, et cetera. And then maybe we can expand this model, much like my colleague from Raleigh and what she's got going on, because these are very concrete, tangible ideas that will be there in one form or fashion long after we're gone. There's other things that need to happen. So like the grocery store, where Salem received a community builder pilot from Edge, right? Like those things are going to have to take place. I will say though that pilot wouldn't be granted under a $21 an hour minimum wage, because grocery stores don't pay that. So keep that in mind when we get to Tuesday. But there's a lot of things that have to happen, and Councilwoman Thomas talked about, like site selection, acquisition, all these things. So I'm very happy, and I thank the councilwoman for reaching out to a development group to start to formulate an order of magnitude. These are the things that I personally am very appreciative of. I'm going to support this. I think it's a great idea, and I appreciate Councilman Ford's comments as well. And I look forward to helping in any capacity in which I can be of help. So with that, I'll yield the floor.
Good. Thank you. Councilman Johnson?
Thank you, Chair, for the opportunity. I want to say, first of all, I support this initiative. We definitely need grocery stores, but I am requesting clarification in regards to, if the money is set aside, what actually happens to the money in this situation?
What do you mean, Councilwoman Johnson?
Where does the money go to?
So the money is going to go to Promise Development Corporation to be able to implement this as we vote on it. So I know when we did the amendment year 1 of ARPA, I put on there for $1 million, and year 2 for $2 million, and year 3 for 0. So our chief has come up so he can clarify more on the process. But in order to fulfill it out, there has to be someone to do it that's not the city, or that's also not us. And that identified person or nonprofit development group is Promise Development Corporation.
Okay, I got confused there for a second. Are you telling me that you're going to give the $3 million to Promise, or is it $3 million of funds going to be set up like a CIP program, and once all the information is submitted, then the funds are released? I'm confused how this will operate.
So it's capitalizing a fund, but it would not be a reimbursement. Is that what you're asking?
Well, I'm asking, Okay, if we approve this resolution, I'm for it. Remember, I'm for you. I'm all the way for it. I'm even interested in being a co-sponsor for this, if you allow me to.
Yes, ma'am.
Okay, but I just need to understand how it's going to operate under these circumstances, because I know we got a timetable we have to deal with this funding, and I'm just curious how we're going to see this all the way through. And I just like to have information so I can share when people ask me the question, because right now I only see us setting aside $3 million someplace. I can't see us giving $3 million to Promise right now without any definite plans and
Right.
directives.
So you're exactly right, Councilwoman Johnson. So as I envision this, and I'll give it to you for any clarity that would be on what we can or we can't do. But for us to set this aside and to be able to allocate as we go,
Right.
because on the first step is, this is an initial proposal, but in order to get this full plan out, it's going to need to be money behind it. Since I'm spearheading it along with you all as the council and folks who care about Memphis. So it would be incremental and not all at the same time. That won't be the X.
Okay. I have another question, and I think this goes to Chief. Okay. Please explain how these agencies will actually receive the funding in this situation, because it's my understanding this is like a reimbursement arrangement, not grants per se under this particular program.
Well, okay, to address several things.
Okay.
When you all are complete with the 20 million and you have your resolution, you will be allocating the money for various initiatives, and that money will then be earmarked. That's not a great word, but it will be dedicated to that. So $3 million, $1 million from this year and $2 million from next year will be dedicated to the grocery project. It shall not move from the fund. We have a separate account set up for it. It will be there. It will be dedicated to this purpose. As Councilwoman Easter Thomas mentioned, when your vendor is ready to move forward, or when you're ready to capitalize the fund, we'll bring forward a resolution to appropriate, whether it's 1 million, maybe it's some subset of that, and you appropriate that, you all will vote, pass it, and then we will issue forth a check to the company. Now, once this is done, we will enter into an agreement. Councilwoman Easter Thomas will help us inform how she would like to see it done. We'll have an agreement with whomever the developer is that says, okay, you're a vendor for the city, and here's your grant agreement or your performance agreement, however we would like to shape that. But consistent with what you're trying to get done, we will memorialize that in some kind of an agreement with the city. And then when they are prepared for the first increment of funding, we will bring forth a resolution to appropriate that increment and then issue it forth to the company. Yes. It can be either, to be quite honest. It can be either. Yes, so you can, just as we allocated ARPA money to Regional 1 Health, you guys allocated $2 million to them based on what their program of need was. We appropriated that, and issued them $2 million so they could hire additional staff. So we can do it either way.
Thank you, Councilwoman. Can I respond, Chair, just really quick to get clarification for myself too? So is it safe to say that this is going off of, I'm glad Councilwoman Johnson brought that up because I need to be able to be clear in that as well. Allocating it towards the fund and nothing would be spent or appropriated until we voted on it after details are finalized.
Yes, ma'am. So when you approve all or in part these allocations, it is locked in. And nothing can happen to that money. It's a subset of the $80 million we received. It's in a separate line for this project. And unless and until a resolution appropriating the money is passed by this council, it can't be issued forth. So the timing will be based on where and when the project is ready to receive that.
Thank you, Chief.
Councilman Jones?
Thank you. Seeing that the total cost of this is 6.5, has it been discussed what their plans are for raising the additional funds and what happens if they fall short of that number?
Thanks, Councilman Jones. So, yeah, so I've been in talks with folks across the street at our commission, and there is, I won't say total support, they haven't talked to everyone, but there is overwhelming support on that side for the use of ARPA funds. And then also within our administrative fees, and you all, well, I'm not going to say their name, but looking at within our plans also to be able to reach out to further organizations and avenues of support so that it can be a more holistic effort from the city of Memphis. Now, if things do fall short, that does go towards putting in the plan a restructuring of what we're actually able to do while still being able to get the main priority, at least minimum, of resources that we want to provide for that area.
Okay. And so just looking at about $6.5 million, I know that the grocery store business is a very low margin business. And so that's part of the challenge, you know, just overall, you know, they spend $1 million, they may have a profit of 2 or 3, well, 20, 30, 40,000 with margins being so low on this. So I understand the spirit of it, but I just, from an immediate need and when we could actually have some things up and running, you know, to have money sitting on the sidelines for 2 to 3 years before we see anything even come out the ground, that part is a bit concerning is a bit concerning to me. Still knowing, notwithstanding that we have that issue. So another question that I have, and maybe I know that there have been some cities that have operated things on a different scale, so they may not be on the size of a Save-A-Lot, but they're more so smaller operations. Is there any, does this contemplate looking at different models of addressing this food desert shortage?
So, Councilman Jones, you might have been in the meetings because you're saying a lot of stuff that we talked about. But yeah, so we're looking at a 10 to 12,000 square foot store. And we know that that's not a supermarket because the area doesn't call for a supermarket based on the market study we did last year. So we actually are looking at various options for how to get, and when we say grocer operator, it doesn't necessarily have to be a big name that we can all call off, but individuals who are able to operate. And I mentioned earlier that last line on that budget says grocery store operator loan model after what we did to get that cash savers into that Lamar location, because it is a lot of startup, especially when you're in a low income area and it's not the highest yielding profit, but being able to say, we want to support our folks so much, we're able to not give you this as a private business. That's not what we are in the business of doing, but loan it to you so that you're able to get started and get resources to us faster. So we do intend, we are working on finding a grocery operator. We have one of the, I call him one of the best folks in the city, but the main person people call when they're trying to get a grocery store in this city, working on finding those operators from all over the region and not just within Memphis, to seeing who will be able to go into their square footage of space, and then also seeing how soon could we do it with money in hand. When I started this conversation, when I just got on the council, COVID wasn't anywhere near. There was no inkling of where a dollar, could be found to help spur this private and public effort. So it's a different conversation, when you do have an allocation than when you're in North Memphis saying, we don't have a grocery store, we don't have a bank, we don't have these resources, we don't have anything over here, and we don't have any money. So there's two different conversations that we're having from February, March 2020 to fast forward to now. So I will say, just in short, answer your question, we are looking at those other options. And definitely, if we go ahead and get an operator confirmed, especially with the support here across the street with the commission, then I would estimate to see stuff in the ground soon.
And I won't belabor the point, but I was visiting my mom, and I go out there on Sundays, and I go to Trader Joe's out there. And one of the things that I sort of thought about when we talk about business recruitment, I don't know whether this is an administrative issue, I don't know that this is a chamber issue, but the way that I envision things, we need to have almost like a business recruiter or a type of company recruiter to basically say, we want you to come to Memphis, and we are, maybe it exists, maybe it doesn't, but, you know, to say we want you to bring us this type of store to this part of town, or just to Memphis period, some of the operators and operations that we do not have here. You know, the Trader Joe model, they aren't usually in the suburbs. They're usually in the downtown areas. But I don't know if we have anybody from whether it's the chamber standpoint or from the administration standpoint, hey, come downtown, and these are incentives. We should be doing that, whether it's EDGE. I don't think that exists. It goes back to that meeting before y'all on the council. Who's on first? Who's on second? Everybody's pointing the fingers. Oh, I thought that was your responsibility. Oh, no, we thought it was yours. So here it is. I'm 6 years in, and we still are having these conversations. Thank you, Mr. Chair.
Okay, thank you. I'd say of the $42 million that's been requested, this is one of my favorite ideas. I really do like the concept. Today, I don't intend to vote yes on anything because I want to hear everybody. So you're probably going to hear me abstaining or voting no on certain things because I just want more information. I want to hear from others about what they're presenting as well. But I do want council members to keep that in mind. We have had $42 million in requests, and you know, so if we keep going down the line approving resolution after resolution, we're going to find ourselves over allocated and then the unenvious position of having to go back and cut what we've promised to someone. So let's just be cognizant of that. Any other council members in the queue? Councilman Easter Thomas, wrap us up.
Thank you, Chair. I do want to say that I do appreciate the inquisitiveness of everyone. It's going to help as we develop this fully out. And I think that that's the beauty of what's being presented, is that just noticing that there is no current entity working diligently to get something that's so molded with the private sector, such as a grocery initiative, whatever that might look like, into this area. But with this and what we have the opportunity to do today, it's a chance for us to see it full out. We're not giving it all away at once and just hoping it turns out right, but incrementally with details as they're finalized and fully brought out and brought to us. That's the opportunity for us all to say how much we're going to be involved in making an investment for future generations. And I did, Mr. Whitney, Carlisle, Councilman Carlisle, and Councilwoman Johnson asked to be co-sponsors of it. And I asked for everyone, if you will, because I want this to be a joint effort. I want for us to look back in 4 or 5 years and say, I'm so glad we spent ARPA money on this endeavor because it's changing the lives of Memphians, which we are all looking to serve. So with that, Chair, I do move for this resolution to allocate $3 million from ARPA to the grocery store initiative, putting in a capitalization fund that we can appropriate incrementally as we see through.
Is there a second?
Second.
All right, it's been moved and properly second. Let's go to a voice vote. All those in favor signify by saying aye.
Aye.
All those opposed? The chair abstains. All right, this will receive a favorable recommendation, will be on our October 5th council agenda. All right, Councilman Smiley is back. There has been a time-sensitive issue with one of our presenters, so I am going to go to the DMC next and Mr. Paul Young. That presentation only took us 36 minutes.
It won't take as long.
So we have not done a good job of self-discipline on our own time, so I'm putting council members now on a 3-minute clock. And that includes if you need to ask questions of the presenter, if it is significant or relevant, other council members may yield you their time, but let's try to move a little faster and get more direct with some of the questions and answers that we get back. Mr. Young, are you online?
He's online. He has to go really quickly.
All right,
It won't take long.
that is great news to hear. All right, Mr. Young, the floor is yours.
So let me speak real quick so I can give council kind of
Councilman Smiley,
overview of
you're on the clock.
what's going on. So essentially, what I wanted to do is I wanted to make sure that we put the funds to get used like all of the other council members. And, you know, I'm gonna go back to the resolution we passed, I think maybe in June, where we said that there's a lot of areas in the city that is in need of blight remediation and beautification. And I had having the same conversation with Mr. Young's predecessor, Oswald, and now Mr. Young, to figure out what we can do to clean up different parts of the city. And I think most members of this body know the area of concern for me and the potential to have entity that, you know, does provide good services and serves as the keepsake for the entire city. So what my request is for this body to allocate $1.5 million to the downtown Memphis Commission so that they can help with the blight remediation beautification efforts. With that, Paul Young, the floor is yours, sir.
I'll just briefly add a little bit of color. Thanks for having me. With the blight remediation efforts, this is not dissimilar to some of the work that we have already been doing as Downtown Memphis Commission. Acquisition of property, remediation of property, demolition if needed. Those are the types of uses that we would like to utilize these funds for. We would look in areas of South City, which is a priority area. I have read through some of the guidance around the ARPA, and I do know that this type of activity would have to be dedicated to what they call qualified census tracts. So that basically means low income census tracts for which most of South City would be eligible. So that is our ask to allocate these funds. Given that we are talking about real estate, if there are issues with acquisition, we would relinquish these funds after a period of time. I was thinking after a year or so, if we have not been successful, then in order to make sure that these funds are expended and put to good use, we would allocate them back to the council to go towards other priorities at that time. We want to be very aggressive and try to do some things that's going to have a long-term impact on communities that were hit hard by COVID, where the problems were exacerbated by COVID, but also had challenges prior to that. And so I'll close there and I'll welcome any questions that you have.
All right. Thank you, Mr. Young. Any council members in the queue? Councilman Smiley.
So I think the last council meeting, we passed out the resolution, but I think it's important for me to know the last part of the resolution talks about, you know, if Downtown Memphis Commission cannot, use the funds within a year the way that this body deems appropriate, the Downtown Memphis Commission will be giving back the $1.5 million back to this body so we can do as we see fit.
Okay, thank you. Councilman Carlisle.
Thank you, Mr. Chair. I'm aware that Councilman Smiley has been pursuing this, I think, since he was campaigning.
That's
and
true.
has tried every single avenue and has worked tirelessly with the administration to make some impact along that center. As a matter of fact, we've introduced him to people that are stakeholders, and he's met with them. And so, again, this is just one of those things where all options have been exhausted, and to support a colleague in something that's got a tangible, concrete, positive impact on an area, and in particular, of just a visual nuisance to Crump Boulevard. It's hard for me to not support it, and obviously, Paul Young and the DMC, I think, would be good stewards of this capital, so I'll be supporting this resolution as well.
Thank you. Any other council members? All right, seeing none, I guess we don't have a resolution in front of us. It'll be up for consideration.
Okay.
At the next.
Thank you, Paul. I know you have to have a great day, and congratulations.
Mr. Young, let's connect sometime next week. He hung up on me.
Yeah,
all right.
the anniversary gets to you.
I like it. Let's speed along. All right, next up is Satellite Hub for the Homeless. That was much better. That was 5 minutes.
Thank you, Chair. And Also want to say that the last meeting we were going to present, we had presenters and we were told that we could have them today. So I don't know if we could stay within that 3 minutes. I'm going to try to keep everything in there. But anyway, thank you for the opportunity as well. Colleagues, today I ask your support for a growing population in our city, Memphians who are experiencing homelessness, some for the first time, others for many years, here on the streets, in encampments in the woods, under bridges, in cars on parking lots, at shelters, or with relatives or friends' homes. Wherever life is taking them, they need our support. Over the past few years, we've stepped up as a city and met the challenge by funding and building one of the most unique, innovative, trauma-informed, people-centered facilities of its kind in the nation for those experiencing acute or chronic homelessness. This life-saving community is in our city's core, and it's a testament to what we can do when we are solution-oriented and laser-focused on meeting the need. However, the pandemic has only amplified the need for services and shelter provided outside of the city core. Therefore, I am proposing that we allocate and appropriate $3 million towards the construction and operation of a satellite hospitality hub, namely Hospitality Village. This property, Hospitality Village North, will house 16 studios, 8 cottages, case management, therapy, rapid rehousing services, and monitored public restrooms, showers, a kitchen, a community room, laundry, and more. And with that, I'd like to read part of the resolution. Sorry, I'm going to start with whereas, thank you. Whereas the COVID-19 pandemic has amplified the need for homeless services outside of the city core, and whereas the City of Memphis ARPA allocation plan allocates $21.1 million for housing and community development initiatives, with zero going towards housing for those experiencing homelessness, and whereas initiatives to address homelessness, such as supportive housing, are services available for ARPA funding. Now, therefore, be it resolved that the City of Memphis allocate $3 million for the construction of a satellite hospitality hub within City Council District 1. Be it further resolved that the City of Memphis administer the ARPA funds for these purposes through December 31st, 2024, in a manner reasonable and necessary to ensure completion of the satellite hospitality hub for the homeless by such date, and I so move. And since we are introducing resolutions now, I just went ahead and introduced mine. I do want to yield the floor to
First of all, is there a second on the motion? Second. Okay. And then we'll go to the queue. So
this is a joint sponsorship.
Okay.
See myself and Councilman Canale.
All right. So we'll go to Councilman Canale, then Easter Thomas, and Jones, and Johnson.
And we also have some have a video and some pictures. The pictures. And someone online. Okay. Go
do we have Jared, Kelsey, or Tori available?
Yes.
Okay.
Okay.
Councilman Canale, do you want to go now, or do you?
I don't really have anything to add. Councilman Logan beautifully described the project, so I'll turn it over to Jared or Kelsey, whoever's on the line.
Mm-hmm.
Thank you, Chairman.
Okay, whoever's online, and your position for the record. Then the floor is yours. We got a little feedback. If you can, if that's wind or.
Sorry about that. This is Kelsey Johnson. I am Executive Director of the Hospitality Hub. I live at 670 Madison Avenue in Memphis, Tennessee. And I am thankful to have you guys here. What Councilwoman Logan is proposing today. We've done quite a bit of outreach in her district and have been successful with these outreach efforts in identifying who's homeless, who's a veteran, who should be getting disability. I apologize, I'm in my car because I got to catch a flight, but I'm parked on the side of the road. And we've been able to house a couple of her people. I don't mean shelter, I mean house permanently a couple of people who were sleeping, living, and camping around the Walmart at the corner of Austin P and Covington Pike. What we're able to do as a hospitality hub is touch people, find out what's caused their homelessness, what's keeping them homeless. And with this project, it's very unique. We did a pilot program where we have 5 what we call hub studios, and we started moving people into those studios back in July, and we've basically turned them over. When I say that, we have 5 units, and since July, we've permanently housed 5 people who moved into those things. So we have 4 new people there now, and 2 of those people are on what's called the by names list. So they'll be housed soon, within the next 2 weeks. The value of this non-congregate shelter plan is that they're close to professional case management. We can touch them every day. And there's so many people, in addition to the danger of COVID, there's so many people that because of mental health issues, PTSD, just years of living on the street, they cannot go to a traditional shelter. And if you're not in a traditional shelter, somewhere where we can touch you or reach you, it's harder to find out what you qualify for and get you out of homelessness. And so what we've been successful at is using these small non-congregate shelter units to, number one, get rid of the tents. The city of Memphis, we are not fans of tent cities and tent encampments and people sleeping outdoors. So we bring people indoors to a beautiful space. They have case management every day. They have bathroom and shower facilities right there with them. We have laundry facilities, and and it's just a great program. And in her district, there are so many people who are camping out, sleeping outdoors, and it's causing an economic burden on the businesses in that district. The business people reached out for help, and then Councilman Logan contacted us, and we've been able to respond. But if we have a place where we can closely touch people, and they have a place that they can live while we're getting them into something more permanent, it's just perfect.
Thank you, Kelsey. If you all look on the screen, you'll see. If you look on the screen, you'll see some of the businesses, what's going on in my district. Those are people actually sleeping in front of businesses, and all of that stuff is in the business front yard, and so the policemen are picking them up, taking them to the police station, then they have to let them go, and then they're right back. So this is a sustainable solution. We don't want to just keep that revolving door, but we want to get help for them as well as help the community and the businesses. And we have also Jared Bingham on the line who can speak to the development. He's one of the ones who helped develop the hospitality hub and can speak to answer any questions that you all may have. I do have a video. If you all are not familiar with what the units look like, if you want to know more about the units, we can show that video. But this is just a holistic approach to assisting Memphians who are experiencing homelessness for any reason. Some of them are experiencing homelessness through divorce or through the loss of job. Children are getting caught in the mix, and it's affecting them in school. And we don't want to just have a blind eye. We see people on the corners. We see people in these encampments along the side of the road. There are a number of Memphians living along the Greenway. And I think this is the most innovative model between these studios. And then if you switch over to the next picture, and you show the cottages, the picture of the cottages. So this proposal is for the village, which includes these studios, and it also includes the cottages for families. A lot of times women with children don't have anywhere to go. Most of the rooms are for men in our city, and these types of cottages will be for families. It'll give them a more stable environment that's close to home, what home would be like, as they're getting support and services to get back on their feet and to be reintroduced to the community. So, and this is a community. Like I said, it'll include all of the amenities that are needed: public showers, restrooms, a kitchen, a community room, laundry. And the main thing is 24-hour support, wraparound support, therapy, counseling, case management, those types of things. And and I would love to see one eventually in each part of the city, not just downtown, but in the north, in the south, in the east. At least, so they're more accessible, because some people won't leave their environment and go downtown. They like to stay close to the stores they're familiar with, the people they're familiar with, but this is a more people or person-centered way to support our fellow Memphians. And I love the fact that Paul Young, at the dedication of Hospitality Hub, made it a point to say that these are Memphians who are experiencing homelessness as opposed to homeless people. We categorize them and we put that label on people, but for the grace of God, it's not one of us experiencing homelessness. And so we want to treat our fellow Memphians with dignity and care and compassion. And so that's why I would love your support today, myself and Councilman Canale. And if you have any questions?
We've got 5 members in the queue.
Okay.
So again, I'm going to start reinforcing the 3 minutes. Councilman Easter Thomas.
Thank you, Chair. I just want to be added as a co-sponsor. Recently seeing the work that Hospitality Hub has done in my district off of Danny Thomas, this is definitely needed for Memphians all over the city. So thank you, Councilwoman Logan and Canale, for bringing this forward.
Thank you as well. And I was trying to raise my hand to get on yours to be a sponsor on the one you just did.
We're going to put everybody on there unless they don't want to be.
And I failed to mention the implementation team is 80% MWBE as well.
Thank you, Councilman Jones.
Thank you, Mr. Chairman. Colleagues, I'm really encouraged by some of the discussions that we're having and some of the projects that we're looking to do with this. However, still keep in mind that we've allocated and already appropriated much of the money. So it's going to have limits as to what we can do. And I'm going to challenge you all come next budget season to fund these things on a permanent basis. We can have all of these great ideas with one-time federal money, but we're talking about permanent issues in our community where if we have this one-time federal money and we don't do anything after that, it's just a failed effort on our part to address a permanent issue. If you could pull up, I wanted to, as part of this discussion, I don't know if the folks from Hospitality Hub are still on and can be our screen. When I was out in Denver a few years ago, this is a public restroom that they have for the homeless, really just for anybody. And so I'd like to see if it's not part of this, as we address homelessness in our community, let's have some of these monitored public restrooms and showers for this community. Because, like you said, but for the grace of God, we're not in that situation. But this is the type of things that I think that we should have as a priority to show that we care in this community. One of the things that I talked about doing budget was this affordable housing trust fund. But let's have a permanent funding model for issues that are important in our community, like the homeless, like affordable housing, which we're doing, but I don't think that we're just using one-time federal money to address this issue. Thank you, Mr. Chairman.
Thank you. Councilman Johnson.
Before, Councilman, I wanted to say something about what he just said.
Please, very quickly.
Okay, well, I'll go ahead and give her the floor then.
Okay.
Right. Yield back, I'm sorry.
All right, Councilwoman Johnson.
Okay, thank you, Chair, for the opportunity. I definitely commend Councilwoman for assisting the homeless. That is dear to my heart. I try to support the homeless in every way possible. Everybody knows I am extremely great supporter of Collins Chapel and helping the homeless. I think we're going to find out is it's becoming a way of life for a lot of people. You'll be surprised with how many people are actually living in their cars, living with their children in their cars, and they're getting up, going to school every day. We got a lot of homeless possibilities. If this eviction occurs, you're going to see a lot of people out there because of that. It's a situation in where so many people live from month to month that homelessness can easily become a reality. So I am definitely in support of this. But I guess one question I have is in regards to its implementation. Will it be handled in the same way the grocery store concept is going to be handled? The funds will be placed aside, and once all the detail is worked out, then we will go forward, is my question.
That is my understanding. Chief McGowan may want to interject, but that's my understanding of it as well. We also have one of the developers from the Hospitality Hub, Jerry Bingham, on the phone, but I'm sure Chief McGowan can answer that.
Unfortunately, I wasn't listening on the way down, but I believe this is for the homelessness initiative. And so if you are to pass this with this money, it will be allocated to the project, and no money will move until such time as you are prepared and the developer is prepared to bring forward an appropriation. And I think, as you were saying earlier, Councilwoman Johnson, you're allocating it for the purpose, then you're going to work out the details and the flow and the timing. And then when you are ready to come forward, you would bring forward the appropriation resolution. So it'll be stay in that fund until such time as you guys decide to move it.
Okay, thank you. Chair, I have one other question, if you would allow it, please.
35 seconds, yes, ma'am.
Okay, let's say that we go through this entire slate and everybody votes for everything. We're close to $40-some million. So what will happen next Tuesday?
Well, anything that comes out of this committee is just a recommendation.
Okay.
So it's not binding on the body. It's not been allocated yet until it's approved by the full body at a city council, one of our full meetings downstairs. So this is the problem that we ran into with grants in 2016 and 17, and maybe 18 as well, where we allocated what we budgeted. In the grant situation, we never cut it back. And here we have to, because this is a fixed dollar amount from the federal government. There's no really budget on this. So we're just going to have to find 7 votes to allocate $20 million or less of funding paired up with this $42 million of requests. We're just going to have to hammer it out.
Okay, so come next Tuesday, during the voting process, I guess the resolutions will have to be amended for a reduction, since we have resolutions on the table that's going down?
Well, I'll say, actually, so we have $19,750,000 that's left. $250,000 was already allocated to ShotRx from the $20 million council initiatives. And it could be next Tuesday. It could be longer than that. It could be delayed. It could be that one council member, after hearing everything today and already looking at the other initiatives, comes forward with, some sort of paring down and group of what they want to fund and see if they can get 7 votes. Or we could, end up piecing it together. But I know that we're not able to allocate over $20 million. We can't allocate more than that. So at some point, we're going to have to stop. And I think we need to be considerate of that as we go, so that the people who maybe presented last or at the end were not disadvantaged just by the chance that they were at the end. We want this to be on merit, and we want this to reflect what our will is of our priorities, not just the timing in which they were heard. So I think there does need to be some discipline exercise by the council, not because it's fun to be positive. It is fun to vote yes, and there are so many worthy causes on this, but we don't just want to vote yes on everything and then realize, oops, we didn't budget like we should have.
Okay, thank you for that, Chair. Thank you for the opportunity.
Question.
Yes, if it's to what was just.
Yes, just a question.
Okay.
I'm looking at, everybody's looking at 42.
Can you use the microphone, Councilman Ford?
I'm looking at 42 million, so actually we're 22 million right now, right?
These are
we can only use
these are
20.
what's been requested, yes.
Yeah, so we can only use the 20.
Correct.
So we're 22. Okay, that's all I need to know.
Okay. All right, we're going to go back to the queue. Councilman Warren.
Thank you, Mr. Chair. This is a question for Reverend Bingham and Reverend Johnson, who I have to make known buried my father-in-law and my brother-in-law respectively and are good friends of mine. Gentlemen, this $4.681 million, is this the entire amount that would be required to make this project go forward? And was it in your plans to get this complete amount from the city, or had you plans for other sources of funding that we could, if we don't have the whole $0.6 million, that you have some other way that we can also fund this project? And I would like to be added as a co-sponsor. Councilman Logan, Councilman Canale, please.
Okay, I think Councilman Logan has the answer to that, and it has been amended to a $3 million ask instead of a 4.681.
Okay,
Councilman
yes,
Logan?
the project cost is the 4.68 million. However, we're asking for 3 in light of our previous conversations and meetings that we all should go back and try to cut costs. And so we've reached out to some other agencies and entities, HCD and county reps and state reps, and so we're only asking for the 3 million. We have others that have, pretty much committed to it as well.
Perhaps
for the other 1.6.
Who are the other people that we know have committed at
or
this
that
point?
we're looking to, we're looking at these sources. HCD has a fund, let's see, the name of it, it's an emergency fund that could be used for operations, and we'll be, we've already kind of mentioned it, but they haven't confirmed, but their fund source is there, and it's the emergency, let's see what the name of it is.
Yeah,
Do you know what that one is? There's a fund that they have for emergencies that could go towards the 580,000, and then the home funds are available for this as well, which is HUD funding.
And I'm wondering, what I wanted to also hear from Reverend Johnson and Reverend Bingham is what sources outside of government funding they have used in their prior projects, and just so we as a council would know where they're going to be looking in addition.
Mr. Bingham, Jared Bingham is on the line and can speak to that.
Hi, everyone. I don't know if my microphone's working. Yes?
Read you loud and clear. Go ahead.
Okay. Thanks again. So we're fairly successful at raising funds outside of government contracts. In the last 2 years, we raised about $9 million to complete the project of 590, which is the barrier-free shelter for women experiencing homelessness with the attached day plaza and the public parks. So in preparation for this project, we did a lot of diligence around our current provider set, including CAFTA and Community Services and MIFA and Christ Community and Office of Emergency Management, to ask what is the most effective way for us to move this needle structurally on an ARPA funding request. And the studios have been such a wonderful innovation that we agreed together that studios around comprehensive case management and public restroom facilities would be the best structural improvement in the network. And so the next piece of diligence for me was to contact our friends at the Community Foundation and ask if they would be interested in supporting a project like this, if it could get some traction in this time, and they are interested. So we anticipate a gap, and then I'll go to work and help fund the gap. The most challenging part for us is that ongoing operations work. And so the closest we've gotten there is because many of the businesses in District 1 have been bothered by the prospects of an economic downturn from the increase in, we think, COVID-related homelessness, and especially a COVID-related aversion to congregate shelter. We hope we can get some business support for the ongoing operations model, but we'll also be working closely with Chief McGowan and with you all to make sure that whatever we build, we can operate.
Thank you. Thank you, Mr. Chair. Thank you, Reverend Bingham.
Okay. Thank you. Councilwoman Robinson.
Thank you, Mr. Chair. I support this initiative, and I'd like to be added on as a co-sponsor. But I also like to ask the maker of the motion, Councilwoman Rhonda Logan, if you could add a paragraph where you would add a committee to look at a comprehensive plan for housing of the homeless so that we can start pulling some of these plans together and say what we need in the future, like you said, in other areas, the 4 quadrants of the city. We need a plan from this council that says that this is what we're going to support and this is what we're going to be doing moving forward.
Definitely. We've been in discussion, so that's right.
Okay, so will you please add that whereas?
Yes.
We will establish a committee and your staff will know what to do.
Yes. Look, I think Lakivia is taking notes of that.
Okay.
Definitely.
So
Thank you for that friendly amendment.
You're quite welcome.
Okay, and then Councilman Logan, why don't you bring us home?
I just want to thank everyone for their understanding and support and compassion for the Memphians who are experiencing homelessness. And thank you all. I would like for everyone to join in solidarity so that Memphians will see that this sitting council is concerned about all aspects of their lives and all citizens of Memphis now and moving forward in creating a sustainable plan for this population. Thank you. I yield back, Chair.
Thank you. Seeing no other council members in the queue, I assume you all ready to vote. It is moved by Councilman Logan, second by Councilman Canale. All those in favor signify by saying aye. Aye. All those opposed? Being the chair, the ayes have it. This will be on our agenda for the October 5th council meeting. Next up.
Sorry about that. Are we going to formulate this into one document so we don't have to do 37 votes on Tuesday or whatever? Okay, good. Just one appropriations document. We'll take it all on.
Yeah, well, we
can talk about it later. We can yell about it.
Yeah, well, that's complicated because again, you've got a lot of requests that are not being mentioned today. So, yeah. Okay. Okay. Next up is the Memphis Food Waste Project. Councilman Canale.
Thank you, Mr. Chairman. Ashley, do we have a handout? Janet Boscarino on the line.
I'm here, yes.
Mr. Chairman, I think that all of us are very aware of the food insecurity we have here in our city. And I believe everybody on this body knows Janet Boscarino from Clean Memphis. I probably would not do it justice to go through this. So I'm going to give it over to her and let her explain the Memphis Food Waste Project.
Thank you, Councilman Canale, and I appreciate the opportunity to speak to you guys today. I spoke to you guys some months back about the launch of the Memphis Food Waste Project. And so I'm here today to provide some information about a request that we have. As COVID-19 continues to impact our community, ensuring food security is key to human thriving. The Memphis Food Waste Project really seeks to maximize resources we already have on hand to match excess nutritious and quality food with people who need that food. So we're working to reduce the food waste in Memphis by 50% by 2030 through prevention, donation, and composting. That aligns with the national average and aligns with your comprehensive planning process. If you'll move to the next slide, please. So it's a preventable problem. What we have is that 40% of the food that is grown and produced in the US and here locally is wasted. Our partners, the National Resources Defense Council, estimates that we have more than 5,000 tons of rescuable food in Memphis each year. Less than 8% of that donatable food is being donated to food insecure population. And there are more than 115,000 Memphians who are food insecure. To be clear, the Memphis Food Waste Project is not about addressing, our goal is not to address food deserts. That there's no substitute for a quality grocery store and farmers market in your community. This is about better management of resources and resources that already exist in a community and make sure that they get where they need. The other problem with food waste is that 55% of uneaten food ends up in landfills, and City Public Works has to deal with that. We also have food waste in landfills have produced methane gas, which is harmful for our environment. Next slide, please. What we're coming to you today about is for three things that we're doing to address this issue and make sure that food gets to people who need it. Our partners within our DC have worked with Nashville, Denver, and Baltimore to develop a landscape assessment. Essentially what that is we work we would work with Innovate Memphis and NRDC to evaluate the interest and capacity for last mile organizations. Those are organizations that are feeding programs in communities to understand their capacity issues, what they lack for cold storage and other storage, transportation, kitchen, all of the different things that would allow them to expand their operation so that they could receive more rescued and donated food and get that food to more people. This assessment would also allow us to create a current database of last mile organizations and to connect them with additional local donors. It would also help us develop a clear communication and safety guidelines for food transport and storage. There's always concern about about food donation and storage and making sure that you're doing that adequately and in the right manner so that we have food safety at top of mind. Next slide, please. The second thing that is a recommendation from NRDC with their work with Denver and Baltimore and Nashville is to hire a dedicated food sourcer. Essentially what that person does is connects people with excess food to people who need it or feeding programs who need it. An example of that would be right now we're doing some of this ad hoc, but we don't have a dedicated staff person for it. Looking at like the FedEx Forum or AutoZone Park, they have excess food that's perfectly good food, nutritious quality food that just goes to a landfill and is thrown away. We'll be working with the convention center, hotel, hospitality industry, restaurants, and other places to make sure that that food is rescued and connected to people who need it. We're also working with Shelby County Schools to make sure that all back of house food at each school and at the primary kitchen would also have a food donation partner. This just saves money across the system and ensures that that quality food again gets to people who need it. Next slide, please. And then the last thing is our 901 Save the Food awareness campaign that we've launched. We've pushed out information about how to properly store food and refrigeration, how to use all parts of the food to expand the use of that food so that it's not wasted. We're working to expand composting across the community with drop-off locations around the city and also expanding the subscription service through one of our local partners. About 25% of food waste makes up 25% of municipal solid waste. So again, the city bears, Public Works and Solid Waste bear the cost of that, and that food going into a landfill and the methane gas production that it provides there. It's a waste of a resource, and this study that we would do with Innovate Memphis and hiring the food sourcer to make those connections would greatly impact and increase our ability to rescue more food and get that food to people in need. The estimates is that we could close 20% of our meals gap by addressing this issue with food waste. We're asking for $190,000 over a 2-year period to cover the staffing position, the research project in addition, in partnership with Innovate Memphis, and to support the campaign. That's all I have. I'm happy to answer any questions. Thank you.
Thank you very much. Any council members in the queue? All right, don't see any. Councilman Canale, do you want to wrap us up?
Hey, Janet, do you want to quickly go through some of the partners that we're working with as far as the donations?
Yeah, so and just to make sure, we have a food waste advisory council that consists of people, Kathy Pope with the Food Bank, Epicenter, a variety of other partners. We're targeting, as I mentioned, in terms of food donation, there are a lot of people with excess and surplus food, but they're not part of a system and connected to a donor. So like the FedEx Forum, Redbird Stadium, the convention center, anyone that has events going on, we're hosting conferences, there's always excess food, the Peabody. So it will be anyone in the events and hospitality space, the district schools, all of our restaurants, all of those would be targeted for the food rescue. And then of course the study would look at our last mile organization partners, which are the feeding programs, to better understand their capacity needs so we can direct resources to them so they can expand their ability to receive that donated food and have an immediate impact on getting food to people who need it instead of it going to a landfill.
Great, thank you. That's all for me, Mr. Chairman.
Okay. Thank you very much. Janet, thank you very much for your time. We're going to go on to the next presentation, which is the Artist Emergency Fund. Councilman Jones is not here. Ms. Rouse, are you on the line?
Yes, I am. Can you hear me?
Yes, I can. Councilman Jones, we're at the Artist Emergency Fund. Do you want Ms. Rouse to go ahead and present, or do you want the floor first?
Yes, I want the floor first.
All right, Councilman Jones.
Thank you, Mr. Chairman. Colleagues, you know, when we were first presented with this, I've made some comments about what I wanted us to do. I wanted us to say that after COVID has passed, some of the things that we've done have made some permanent improvements in our community and have addressed some of the issues. When I look at what the guidelines that were issued by the United States Treasury as it relates to these funds, it talks about to help to alleviate economic hardships caused by the pandemic, coronavirus, state and local fiscal recovery funds enable eligible state, local, territorial, and tribal governments to provide a wide range of assistance to families and households, small businesses, and impacted industries, in addition to enabling governments to hire public sector staff and rebuild capacity. So when it comes to delivering, what it also, among these includes delivering assistance to workers and families, including aid to unemployed workers and job training, as well as households facing food, housing, and other financial insecurity. In addition, these funds can support survivors' benefits for family members of COVID-19 victims, supporting small businesses. So what I was approached back during budget season about the arts, and I would contend that when we talk about one of the organizations, a couple of the organizations that you'll see on here will be the Orpheum, but there are other arts and arts related, whether it's the performing arts, the visual arts, that have been affected by this. You know, shows aren't taking place at the Orpheum, Theater Memphis, Playhouse on the Square. And so what this is doing, this is supporting arts organizations on a direct basis. There are a number of different organizations that would be affected and helped by this. And so that's the theme of it. So with that, I will turn it over to you, Ms. Rouse. And you can, you know, you can go through the presentation and answer any other questions that my colleagues may have.
Great. Thank you so much, Councilman Jones, and thank you all for your time this afternoon. This request before you today is a $3 million request to support the arts community. It is a request for a one-time investment that would go to Arts Memphis and then benefit the entire arts community, both arts organizations and individual artists, through the process that our organization already has in place to accept grant proposals from other arts organizations and artists and fund them. So this is really focused on people. It's focused on individual artists of all types, but also on artists and others who are employees of arts organizations. On the next slide, you'll see a little bit about the critical role that arts organizations and artists have played in our community throughout the pandemic. These organizations, many of them are very much entrenched in neighborhoods and playing critical roles in efforts that are providing healing and connection, and have done so during the pandemic, whether it be programs like Angel Street in North Memphis that has ensured that their students had devices and could connect to those after school programs, or a food bank that Memphis Slim Collaboratory had in South Memphis, or the fact that Carpenter Art Garden has served as a vaccination facility. These arts organizations are vehicles for their communities. And so we believe it's critical to support them and to help them recover so that Memphis can recover. On the next slide, you'll see a bit about the various impacts that arts organizations have in especially for our youth and really helping bridge differences, but also the arts have a huge economic impact in our community, Pre-pandemic, the arts were more than a $200 million industry locally and helped secure more than 6,000 full-time equivalent jobs. On the next slide, you'll see a bit about Arts Memphis. So we are Memphis's local arts agency. We are a 501c3 that has been in existence since 1963. We are primarily privately funded, but we do receive consistent support from the Tennessee Arts Commission and occasional support from the National Endowment for the Arts. But we are not currently city or county funded through other budgets. Through that support of private funders, mostly, we have invested more than $85 million since our founding. And on an annual basis, we provide $2.2 million to more than 64 organizations and artists. We were a vehicle last year for you all to provide $200,000 to artists through CARES funding, and we are grateful for that. In addition to providing funding, our organization really serves as that convener and connector for the arts sector. On the next slide, you'll see a list of some of our 2021 grantees. This is not an exact list of who might be supported through this program because all of our grant programs are open to 501c3s in Shelby County or for this funding in the city of Memphis. But this will give you an idea of the variety of arts organizations, and these groups are doing work across every single neighborhood in Shelby County. On the next slide, you'll see a little bit, one of the roles that we play throughout the pandemic has been to really understand the impact of the shutdown and the limited capacity on the arts sector. And we know from the 45 or so groups that receive consistent support from Arts Memphis year in and year out that they have experienced more than a $24 million revenue reduction because they aren't able to have classes and host performances and that sort of thing. These organizations had staff reductions of more than 53%. And as of today, many of the full-time and part-time positions have been built back, but it is the artist and contract positions that have seen the greatest impact. And so that's why this plan is really focused on especially supporting individual artists. The fact that organizations have had revenue reductions and have had to let go employees or contracts has really resulted in impacting Memphians. We know that there's been a huge decrease in the number of Memphians who are able to experience the arts, whether that be through a school program, an after-school program, or programs like Creative Aging, which serves seniors. So a 61% decrease in arts experiences for youth and seniors since the pandemic. A little bit about our individual artist support. In addition to supporting organizations, Arts Memphis and this recovery fund on the next slide would also support individual artists. And last year, when the pandemic started, we immediately saw how many artists were impacted simply by the closing of nonprofits. And so we established this Artist Emergency Fund that has last year gave about $500,000 to more than 600 individuals. On the right of this slide, you'll see a breakdown of who applied for this funding. And this confirmed to us that Memphis is a music town and that many musicians were hurting because they weren't able to play gigs in businesses, but also because they weren't able to be hired by arts organizations. And so Music Export Memphis has been our partner in administering this fund. On the next slide, you'll see a bit about the impact that artists have felt locally. They have report to us in a survey we did this year that they've had a reduction in income of 64%, that 79% of artists were able to continue their work in some way, but only 35% were actually able to earn any income from their work. And so all of this, when organizations are not able to be open and artists are not able to do performances and to create, it does impact our community in huge ways. And on the next slide, you'll see an estimate of what we estimate as the reduction in local government revenue generated by the arts. So a 62% reduction in local government revenue. That's people not going to restaurants before the arts performance or not doing Uber or other things to get there, and a 61% reduction in jobs generated by arts organizations. And so because of a lot of this data, Arts Memphis and some of our intermediary partners have this recovery fund that is meant to help organizations and artists stabilize. On the next slide, you'll see a bit about what this fund supports overall. It is definitely first and foremost about people. And if you want to jump to slide 10 or 11, so this is about stabilizing organizations and getting people back to work. It is about building back programs and marketing those programs for the benefit of Memphians. It's also about supporting organizations that are led by people of color and those that are supporting people of color in our community and serving neighborhoods. It is about helping the arts infrastructure come back stronger. So our goal on the next slide is to raise $10.5 million that would, paired with Arts Memphis's regular annual support, replace about half of the revenue that was lost due to the pandemic. And we have $1 million committed so far. We have a number of requests in process. We have had some conversation with Shelby County about their ARPA funds, but we do not have a commitment or clarity on next steps with that quite yet. We have been in conversation at the state level, and a lot of our fundraising is also focused on private support. On the next slide, you'll see a bit about how this money will go out. It's really important to note that we'll be giving this money out as it is raised. And so because there is such an immediate need, this will support individual artists through this Artist Emergency Fund. It will fund arts organizations of all types. It will prioritize small to mid-sized organizations, especially those that have been unable to access some of the other relief funding programs such as PPP. And support will really be on helping these organizations bring employees back. So I appreciate your conversation. I just remind you that, the arts are an important economic driver for our community, but they are so important in other ways. These arts organizations are doing many different things, including being an outlet for youth and a way to address mental wellness issues and so much more. So we appreciate your consideration, and I'm happy to take any questions now or later on. Thank you.
Okay, thank you very much, Councilman Johnson.
Thank you for the presentation. Thank you, Chair, for the opportunity. My question is, how are the recipients vetted to receive your funds? Do they have to already be in the organization? How do you go about trying to decide who will actually receive the funds?
Sure.
Thank you.
So we will have an open process, both for artists and for organizations. For arts organizations applying for the funds, they will have to be a 501c3 and meet all of our eligibility requirements. Part of our ongoing work is to be a grant maker for the arts. And so we have a comprehensive system where organizations apply. We use the Community Foundation's Live, Give, Mid-South profile. We help organizations through the process, and then the funding decisions are made by a panel of community volunteers and ultimately by our intermediary partners and our board. So this funding would be open to all, but part of our job is to make sure then that after decisions are made that the funds are spent in the right way. So part of our role is also around oversight.
Do you by any chance check to see how geographically the funds are spread out across the city?
Absolutely. And we track where organizations, not just where they're located, but also where their programs are happening across the city. And this recovery funding, we would make sure that we are touching every area of the city.
Okay, thank you for that information. Thank you, Chair.
Okay, thank you. Any other council members? All right, Councilman Jones.
Thank you. Ms. Rouse, you talked about in your presentation, you indicated that there's been a 50% reduction in staffing. Do you have a number to associate with that percent? It can be approximate.
Sure. So approximately of these, and the data we were looking at for that slide included 45 arts organizations, and pre-pandemic, they employed roughly 1,200 people. And so that was the original number. So we're talking about 600 positions now, and a huge part of those were contract positions that are mostly artists.
Okay. And then I'm also looking at, looks like it might have been page or slide 11. Nope, it was. Well, can't find it here, but can you talk about, has, although things have opened up a bit, has there really been a pickup? I know things aren't quite back to normal, but can you talk about how, to what extent there's been sort of a rebound in these arts organizations?
Sure. So just in the last week, there has started to be more of a rebound. As you all have probably seen, there are more outdoor events happening. Theaters are open, but at limited capacity, but they are seeing, in many cases, people ready to get back to events. I think what this fund is really focused on is supporting individuals who may have a longer road ahead to get contracts back. But it's also about supporting organizations between now and when they can really build back their earned income streams, which reduced by a huge percentage over the last year. And so while they are able to bring people back at limited capacity, we're not seeing that earned income, jump right back. And so this fund is meant to sort of support them in the in-between time.
Okay, thank you. Thank you, Mr. Chair.
All right, thank you. Any other comments or questions from council members? All right, seeing none. Ms. Rouse, thank you very much for the presentation and time. We'll go on to the next one, which is National Civil Rights Museum. This is also Councilman Jones. Do you want to introduce this?
I will, yes. Colleagues, and I know I sound like a broken record, but part of as I thought about this recovery was, we know that there was a hit to the hotel motel tax revenues as well as the TDZ funding models. But what I sought to do is sort of help those organizations that bring people to Memphis, that generate the hotel stays, that generate the tax revenues that we rely upon. And so I thought about some of the larger organizations here. You have the Civil Rights Museum, you have the Southern Heritage Classic that just took place. Sun Studios they didn't respond and wasn't able to participate or come before the council, but we still have the Orpheum, we still have, well, those are the ones that are presenting here today, but that was the thing behind this, those organizations that bring people to Memphis that help generate the revenues that are relied upon for our hotel motel revenues, as well as our TDZ, of which all of these help support. So with that, I turn it over to representatives from the Civil Rights Museum.
All right, if y'all just introduce your name and your title for the record, the floor is yours to present.
Sure, thank you very much, Councilman Jones and others. My name is Russ Wigginton. I serve as the president of the National Civil Rights Museum. And my colleague.
Good afternoon. Thank you for hearing us. This is Beverly Sakawa. I am the Chief Development Officer at the National Civil Rights Museum.
All right, first of all, I'd like to just thank you all and thank your predecessors for supporting the National Civil Rights Museum from its initiation. We consider the city as part of the group of founders for the National Civil Rights Museum. You all may know that we are celebrating our 30th year as an organization and proud to serve this community and as well as the broader country and the world. The National Civil Rights Museum is an important organization for our city, in part because we feel like we have the responsibility of being a beacon for this city in the areas of education, as well as serve as an important economic anchor. When you think about the volume and the diversity and demographic of people who visit the National Civil Rights Museum. It's a powerful example of not just the mission of the museum, but the economic influence that the museum has in our community. Prior to the pandemic, we had a record-setting year of approximately 330,000 visitors to the National Civil Rights Museum. What's particularly impressive about that is about 75% of them travel more than 120 miles to visit the museum. So we are literally bringing people to Memphis. And when you travel that far, it's the likelihood that you are going to, it's very likely that it's going to be more than a day trip. We also bring about 15% of our visitors come from outside of the United States. So we are part of making Memphis a destination city for people across the world. We have a particular interest, as you know, of serving young people. About 25% of our visitors are young people. And the numbers that I just gave you are in part the byproduct of a transformative renovation that we had completed about 7 years ago. That set us on a course to exceed our wildest imaginations prior to that. The pandemic did throw us for a loop, as it has many organizations. Our visitors dropped to about 115,000 last year. And when you think about, if you were to look at those types of percentages that I've mentioned, that means that people were not coming to Memphis anywhere near the volume that they had before. They were not spending money in our community. They were not getting the wonderful experience that we provide.
Where are you?
We are looking at, because of those numbers, that decrease, it affected our projected revenue approximately at a $2 to $2.5 million level. We were very much on course to continue with the kind of growth that we had projected that had occurred the year prior to the pandemic. And that stall in our momentum, this support would go a tremendous way towards making us whole again. During the pandemic, we also had to lay off staff. Approximately 15 of our 57 or 58 staff members were laid off during that time. We are slowly able to bring some of them back. But again, the support here would put us much closer to full capacity. This is really important and a critical time for us to be at full capacity, particularly when you think about the role that we play in this country at this particular time. We need to be whole. We need to represent Memphis for Memphis, but also for the country at large. You could help propel us to the next iteration of the National Civil Rights Museum, which promises to continue to improve its facilities so that one day in the not so distant future, we can bring 500,000 people to this great city of ours to appreciate the National Civil Rights Museum and more broadly, appreciate the tremendous city in which we live. I will pause there to see if there are any questions. Thank you for the time.
Thank you very much. Any comments or questions from council members? Councilman Jones?
So just to reiterate, Dr. Wigginton, prior to the pandemic, you all had about 330,000 annual attendees. And at the last year or the last comparable was 115,000?
That is correct.
Okay. And then laid off 15 of approximately 50 to 58 different employees?
Yes.
Okay. Well, colleagues, I think, going back to what was, I would think that the intent of the federal government in allocating these was to address organizations like the Civil Rights Museum. And I go back and reiterate it again. We want to help those organizations. Well, we can't make you whole, Dr. Wiggins, and we can't plug a $2 to $2.5 million budget deficit. But I still think that from the standpoint of helping those organizations that get people here, get those numbers back over 200 to 250,000 or and to that $500,000 that you talk about, we still want to help those organizations and help further your mission. Thank you, Mr. Chairman.
All right. Thank you. Any other council members? All right,
one other thing I would add. On this sheet, colleagues, the figure on here was 250. When I first presented it, it was 500,000.
So are you saying are we increasing or are we still at 250?
No, what I'm saying is that when I first presented everything, what our budget suggestions were, the allocated amount, if you look at the this
so the
other
requested
sheet here,
amount is 250,000.
No, the requested amount is 500,000.
Oh.
If you go back to this sheet here,
But this is a mistake on this.
right. If you go back to this sheet, this one contains 500,000, and that was the original ask that I had.
Okay, we'll make that request from 250 to 500.
Well, back to 500.
Correct.
Okay, so we're moving back to 500.
Well, I don't know how.
Well, this was a mistake.
Yeah, this just seems like a typo. I'm not sure what happened.
Okay. So I got one comment.
Councilman Smiley.
All right, thank you. Dr. Williamson, thank you for your presentation today. Thank you for serving in your capacity during these difficult times. I just wanted to let you know I appreciate your work and I look forward to supporting Councilman Jones in his effort.
Thank you so much. And Councilman Jones, 500 may not make us whole, but it will give me tremendous momentum to solicit and secure the resources that we need to get back whole and to get to that $500,000 visitor mark at the National Civil Rights Museum. So I really appreciate your interest and concern for us.
And if Councilman Jones would have me, I would love to co-sponsor this as well.
Love to have you. And anybody else?
All right, any other council members? Seeing none, we're going to go on to the next presentation. Thank you so much for the time and the presentation. All right, next up is Relationship Unleashed, Councilman Smiley. We've got 7 down and 10 to go.
Okay, well, I don't think I have to speak much on the work that Dr. Clemens does in the community, as well as her son. I'm gonna let them speak for themselves, but I'm gonna let them share the good news with this body, and I don't want to take any of their thunder. I'm gonna let them do that, but I'm supportive of the work that they do.
All right, Team Clemens, the floor is yours. If y'all can just introduce yourselves and your kind of title for the record.
Dr. Clemens, you on mute.
My name is David Clemens. I am the Chief Financial Officer of Relationship Unleashed.
Hello, council members. Thanks for having us today. I'm Gwendolyn Clemens. I am the Executive Director of Relationship Unleashed, and we are a 501c3 nonprofit organizations that have been in existence in Memphis, Tennessee since 2014. And we're here today, as Council Smiley mentioned, to share some great news with the council and City of Memphis community. Last week, our organization was selected by the #1 singer, rapper, artist right now that's trending in the UK and Billboard, Lil Nas X. He selected our organization as a trusted, dedicated HIV service provider and in launching his new album. And in addition to that, he asked his fans to contribute donations to 13 other organizations in the South that were primarily service providers for people living with HIV and AIDS, where we're predominantly affected by HIV and AIDS, and Memphis being one of those cities where we rank in the top 10 continuously for the last 20 years. And right now we're number 8 with new diagnosis of people living with HIV and AIDS, where 69% of those individuals are African Americans. So today we're here to ask the council members for some financial assistance in helping us achieve our goal. Gilead Science and Compass Initiative and Little Nas X has committed $25,000 as a matching donation to the organizations. And if we raise that amount or exceed that amount, they will also give us an additional $25,000. Where we have seen donations pouring in from around the world in increments of $5 and as much as $100, we are far from reaching that financial goal. And we can. Yes.
I'm sorry to cut you all off. I'm gonna ask a couple of specific questions to help us, speed this process up.
Okay.
So one, the request of this body is how much?
$25,000.
$25,000. If this body is so inclined to give, grant you all $25,000, is there a matching donation?
Yes, $25,000 matching donation.
So there's a matching donation from a well-known artist in the country. And my next question, could you tell us specifically, as succinctly as possible, what your organization does?
Yes, sir. We are a service-providing organization for people living with HIV and AIDS. And also we provide mental health service, trauma-informed care. We provide services to people with substance use, transgender community, job support, referrals out for medical care, educational forums, workshops. We do a lot.
Okay, thank you. And you also mentioned, are you all seeking support from any other entity or private partners?
Right now, we have donations coming in from individuals, and we are also planning a fundraiser right now. We're looking for a location and some individuals to assist us with raising additional funds for us. We don't have the capacity right now with general operating money. Our money is strictly programmatic related that we receive grants from this year. So our general operating fund is almost depleted.
Okay, so that answers my question. So I'm gonna say this, and then I'm gonna see if any of the other council members have questions. There's a philanthropist that's willing to match whatever this body is willing to allocate if this body does deem it necessary or, willing to support this organization. I think we talk about HIV and AIDS in our communities. There was a time in which it was, it was something that we couldn't talk about, but I do think, now is a good enough time to talk about, what our communities need. And we have an organization in the community that's willing, not just willing, that is out here doing the work. And I would hope, other members on this council, in light of some of the other requests, can, find in their hearts to support this organization, especially since they have an individual willing to grant matching dollars. And with that, that'll be all from me. Chair, the floor is yours, sir.
Okay, thank you very much. I've got one question, and I realize that I probably should have asked the same question in the Memphis Food Waste Project, but I have asked it of others and just want to be consistent. With ARPA funds, we know there's some direct uses that we can use, that these funds are allowed for, but also one of the largest one is just, essentially an organization or a cause that has been negatively impacted by COVID. So my question would be, the $25,000 we give to y'all, how is that being spent directly on a COVID impact? Because there's some, there's some causes and uses out there that we may think are great causes, but it's not necessarily a COVID impacted cause. So what's the correlation between COVID and the dollars that we will give y'all?
That's a great question, Council. Last year, we gave $20,000 in COVID relief funds to the community through our emergency community grant fund. And that fund was depleted last year. And that's what we plan to use this money for, to bring it back in and to refund our community care COVID relief fund. That information is also available on our website. And it's in some press releases that I provided when we asked to come before the council today, verifying our efforts and the things that we've done in 2020.
Okay, thank you very much. Any other council members, comments or questions? All right, seeing none, we appreciate the time and effort and the work that y'all are doing. We're going to go on to the next presentation, which is Share the Pennies, Councilman Robinson.
Thank you, Mr. Chair, and you should have a presentation, and our staff should have passed it out. It looks like this, and we'll go through it. Is Lakivia here? You can set me up. I appreciate all the requests that were made and the resolutions that were brought forth, because it was, to me, the council should have spent these dollars in the community, and I see that's what we're doing. I have several recommendations here moving forward that we invest in the people of Memphis so that we will have a greater impact in our community that will actually touch people, improve their living conditions, actually reduce their utility bills, and provide a better place for them. So the staff should have passed out the resolution as well as the presentation. Y'all have a question?
Councilman,
y'all just left me out on that last one. I wish y'all would have had notice.
we're following the schedule that's in front of us, but Councilman Robinson, you still have the floor.
Okay, thank you. If you would look at the presentation, page 2, the Share the Pennies program, I'd like to see us, and this is more than the resolution, I've added something else. One, I'd like for us to allocate $3 additional million to be used in our community to help our senior citizens who are economically disadvantaged and those people who need some help with their housing stock so that they can live in a conditions that are suitable for children that have asthma and other situations that they cannot make those improvements in their homes. Share the Pennies program has lost $1 million from their partnering with TBA moving forward. I think this was their last year. They would need those additional dollars. Habitat for Humanity needs some additional dollars to help with roofing. The money that we allocate to Share the Pennies is not enough to cover the inside the home, making sure they have heating and air conditioning, and ensuring that the envelope of the house is tight. And the Mid-South Food Bank asked for millions of dollars, but I was just suggesting that we allocate the $3 million to all 3 organizations. MLGW Share the Penny program, if you would flip over that to right quick, the average age of the impacted is 65 years old. The average age of the homes are 61 years old. People are 65, their homes are 61, and this is some of the oldest housing stock in our city. This has nothing to do with District 3, this has to do with our whole city. The program benefits for the Share the Pennies program includes reduced utility bills, reduced utility disconnects, and improved air quality and quality of life. Currently, our Share the Pennies program averages about $7,200 per home. The summary of their services, you see them listed here. Thirdly, the energy savings they're actually calculating them every month, and they send us a copy of their report. We're averaging $180 savings, annual savings for those upgrades in their homes. And fourthly, impact of $1 million would add an additional 140 homes. That is a great impact across the city of Memphis and our districts. The Habitat for Humanity, currently, their average age for their Aging in Place program is 77 years old, and their average home is exactly the same, the 61 years, and they have the ability to leverage some of the dollars that we now spend on our seniors. When MLTW completes a home, if they need a roof, they don't have enough money to do it, so they refer them to the Aging in Place program at Habitat for Humanity, and they do not have enough dollars to do that. But let's look at the impact. The Aging in Place program, the average cost per home is, because this is roofing, has gone from $7,000 at Share the Pennies program at MLGW to $13,800. The summary of the services would be roof repair or replacement, exterior repair. They even do air conditioning, window units, wheelchair ramps, and other accessibility modifications. An impact of an additional $1 million would help an additional 100 seniors to be served. So somebody do the calculations for me. If we serve with this program 100, then an additional service for Share the Pennies is 140. We're up to 240 homes. We are now having the kind of impact we need to have in our community. Now, I represent the Council on the Aging Commission, but the Mid-South Food Bank says that they are currently, so look at this closely, that before COVID, they were doing 13.7% of Memphis seniors who experience food insecurity. But that has changed since COVID-19. And currently, they're distributing throughout the Mid-South 12 million plus meals within the city of Memphis. The seniors in Memphis, according to the 2020 census data, Memphis home to 75,972 seniors aged 65 and above. If you turn to the last page of this presentation, we're also looking at the fact that the cost to feed one senior for a whole year is only $294. They receive 37 meals in a month. So if we gave them this additional $1 million, we would add an additional, listen to me, council members, 3,401 seniors. Now that's an impact in your district, in Memphis, and our community. Before I go to my last page, I just wanted to, I'll be through with my presentation. I got a call from Keith Norman at Baptist Hospital. He is on the line. If you have any questions about the Share the Pennies program, Habitat for Humanity, or Mid-South Food Bank, everyone is here in place to answer your questions. But he said that Councilwoman Robinson, you all gave money to the Regional Medical Center, something to Methodist, but you all left Baptist out, and Baptist provided their nursing students to give shots. And they also have indigent patients as well, and they need some support as it relates to staffing for their community. They did not ask me for $3 million. I just put that there as a holding place because I needed the staff to tell me how much money has been allocated to the other hospitals so that we are more equitable in spreading out those dollars. Any questions?
Yes. Okay, yeah, let's get some council members in the queue. And just for clarity, yes, we've got 4 items or 4 different organizations in this resolution you presented.
Yes.
We were going to take them in order, but honestly, if we, for the sake of time, why don't we just try to wrap this all up into one?
Yeah.
And rather than having presentations from the Mid-South Food Bank or Habitat for Humanity or Baptist or Share the Pennies, you've done an admirable job presenting their positions. But if council members have questions, we can engage with their representatives that are on the line. So that being said, we'll go to Councilman Jones first.
Thank you. I'm familiar with the allocation that we provided for the mayor. Was there one for Methodist?
Yes. And I asked Doug to come and share that as well. Well,
Was there a Methodist allocation from the council?
Not from the council. We haven't given anything.
But
Methodist.
I thought it was through our ARPA dollars.
Only stuff we've given out has been the regional one. It's 3 million total.
Okay.
Yeah.
Okay.
That was my impression as well.
Yeah, I just want to make that clarification.
So my concern is that we do something for our major hospitals.
Councilman Jones,
Okay, so if that's the case, would that be, if there wasn't anything for Methodist, do we do something for Baptist and Methodist?
Yes.
Okay, gotcha. And then, colleagues, if you go back to when we were first having these discussions, I came up with a whole laundry list. I had Mid-South Food Bank at 500,000. I would ask that if this is part of any type of resolution, that I be included as a co-sponsor there.
Okay, thank you.
Thank you.
Okay, thank you very much. Any other council members?
And you do have the resolution in front of you as well.
Councilman Ford.
Yeah.
Methodist should have been put in there. If it wasn't, it should have been put in there once we discussed that. And it was actually Methodist Labana, the children's part of the hospital. That's what was more important, because I think I brought it up because, hey, they were dying from COVID. Okay? That was very important. The children.
You write the check to me, I'm willing to write them a check.
You're gonna write us a check.
If you write the check to me, I'll give them their part.
Yeah. Yeah.
I'm a man of the cloth, and trust me.
Yeah, because it was very important, you know, because they were dying. And I don't want to go back to where I was with that, okay?
Okay. May I ask what?
But go ahead.
Okay, Councilor Ford, may I ask a question of Chief while he's here?
Yeah, we
Okay,
can try to get that together.
I just want to know what is the plan for the hospitals and how we're going to support them and their indigent patients, because we've given something to the Regional 1. I was going to call it the me, I'm sorry. And Baptist has requested to participate in that process, and we'd like to include Methodist as well.
Well, as you
Methodist Labana.
First of all, thank you for giving me this opportunity. As you know, we have a mobile unit that goes out into the community to take care of patients, as well as those who come to our hospital. And we've placed a moratorium on any collections at this point. That does not mean that they don't have a hospital bill, but we don't want to see people go down the spiral of having poor credit and having a hospital bill that they cannot pay. So what I'm proposing that we would take the funds and do is eliminate some of the debt of those individuals who had long stays in ICU. We could also direct it, to our nursing staff. We have so many things that we could use it for right now. We're spending about $3 million per month in special allocations of pay just to get through the winter. So we're anticipating that when RSV begins to hit young children, and Dr. Warren can probably speak to that over the course of the winter, we're going to have a surge in confused cases of whether it's allergy, RSV, or COVID, but yet and still we'll have to treat those patients.
Okay, thank you very much. And then Chief McGowan as well.
Thank you, Chairman. The allocation that we had made from this council was $2 million to Regional 1 Health. That was to support the reopening of 21 beds in the trauma and acute care area, and with the idea that perhaps there'd be another $1 million in the future. Methodist and Baptist both were allocated a total of $8 million from Shelby County Commission the other day. There was a concept that we could all come together from all of the municipalities potentially to support any specific needs. This is the first I'm hearing of a direct request of $3 million from Baptist. So there was not a plan in our allocation from the administration for this specific thing beyond the immediacy of Regional 1 Health as the public hospital for that trauma. But I realize that there has been a move across the street at Shelby County government to provide $8 million of relief for our two nonprofit hospital systems.
Okay, thank you. And Councilman Ford, were you through with your comments and questions? You kind of got... Okay, all right. Then we'll go on to Councilman Warren.
Yes, I had heard through the grapevine that we were trying to get all the different municipalities to perhaps use some of their ARPA funds to support all the facilities in the county. And I don't know if you've heard anything about that, but where are we, or is that process still ongoing?
So the idea was there is a state model where hospitals can receive a monthly allocation of money. I think it's a maximum of $256,000. There was an idea on the task force for us to potentially all come together and figure out if there was a local way that we could do it. It would never meet everybody's needs, clearly. But that was offered to several of the other municipalities and to leadership of Shelby County as well. But that idea has not yet been fully rounded out or formalized about how it might happen, and that's Yep, I didn't present it to you because it wasn't fully baked.
Okay, thank you. Is it still ongoing? Or is it dead in the water?
Well, the idea still exists, so.
Okay,
The question becomes if there's a pool of money to fund it. I think Shelby County would say, hey, we've already put $8 million in, so that's the idea.
Okay. Councilman, you said, all right, Councilman Carlisle.
Thank you. Dr. Norman, good to see you, sir.
Thanks, sir.
So my question would be the same for you, for Methodist, and for St. Francis, which is, what does Baptist currently have cash on hand in its account?
As far as operating days of cash on hand, I have not looked at the most recent figures as we've closed out the month. I'd have to get that back to you.
All right, I'd appreciate that. I mean, I'd say to the point, Methodist has north of $1 billion in cash on hand right now. I don't know that that's the same for Baptist, and I'm sure St. Francis is probably in that wheelhouse as well. It's not that there's not a need, it's where the need comes. Oh yeah, $1 billion. $1 billion. Same Methodist has over $1 billion cash on hand. And so, and yeah, I know it's a big number. And also, does your bank have a line of credit and or credit facility that it could draw down on for operating purposes? And what would be the note?
That there is not a current line of credit that we did put out there because that would negatively affect our credit rating. And one of the things that we did not want to do during this period of time is have a drop in that rating, that bond rating as well. And we have currently several projects going on as far as expansion. You may be aware that the one in Arlington is to relieve pressure on the Memphis emergency department. And so all of those things we're finding that COVID had the impact on would just simply assist us in small ways. But then the overwhelming amount of money that we're spending now on nurses, that payroll alone is going to increase outside of the budget cycle by over $60 million unexpected right away. So there are some costs that are coming at us that we don't want to negatively impact bond, credit rating, et cetera, for future projects.
I can appreciate that, and that's a good way to run a business. But I know you guys are also a 501c3 and still, I think, generated in 2019 a profit of $37 million. I think was your net operating income prior to the pandemic. I hadn't had a chance to look at the updated financials. And again, I'm not picking on Baptist. These are just it is to the three major hospital systems. You're asking, we have a finite bucket of money here, and you guys are collectively sitting on billions of dollars in cash. And while we definitely want to address a surge and a need for a labor shortage, I'm not sure that we are the best place for it when you guys are cash cows. So those are if you could give me some of that information, I'm interested in exploring opportunities to perhaps putting a pool of funds out there. But again, even though you guys have a 501c3 status, there's a lot of profit that goes through the hospital systems alone. I think, if I'm correct, you guys did almost $250 million in revenue last year, so or $750 million in revenue. So those are kind of the things that I'm trying to contemplate when you're coming to the city council for a finite amount of dollars. I understand you don't want your borrowing costs to go up, but there's a lot of other places that are having impacts to their bottom line, and their borrowing costs are having to go up because it's just a tough year.
With respect to the position, I think what we're doing is we're looking at an ask for a Memphis hospital versus a system-wide bottom line that you're looking at. And I appreciate you doing that homework. But remember that market, I'm not including our Mississippi hospitals in that. And you're quoting numbers that would reflect that. And I just want to clarify that, not push back.
But that's a fair clarification. Your business is still your business. If you need to shift cash from one division to another, that's fine. I'm happy if the North Mississippi division wants to loan the Mississippi or the Memphis hospital system $3 million. That's fine by me. It's still interrelated, neither here nor there. It's a matter of priorities for the hospital system. And if you guys are more worried about your long-term borrowing costs than the near-term surge capacity, that's fine. I mean, that's a priority of your board, and that's the direction they want to take it. And then let me clarify that. With that, I yield the floor, Chair.
Okay, thank you very much. Reverend Norman, I've got one question. You mentioned hospital debt. What's the outstanding balance of the hospital debt that y'all are carrying? If this is going to be...
I'd have to look at that. I'm looking at these numbers specifically on our Memphis hospital. So why don't I figure back to you, Councilman Morgan.
Okay, I just don't even have the scope of what kind of ballpark it would be. That's never a conversation I've been a part of. And
I'll gladly give it to you.
And so at the moment for this, I'm interested in hearing more. Like I said, I'm probably going to abstain for the moment. One of the things about the vote we made for Regional 1 is it was $2 million, and we knew exactly what we were getting, which was an additional 20 hospital beds at the Regional 1, and that's obviously directly impacted because of COVID and the overflow they have, and they can't run out of hospital beds when we're bringing traumas to them on an hourly basis. So they just have to have capacity. And so if there is any spend from ARPA, from us to Methodist, St. Francis Baptist, my preference, if that's the will of the body to do this, but it'd certainly be my preference to see it have a direct link to COVID and the services that they're able to provide related to COVID and just some of the logistical problems that they've had to face over the last year and a half that haven't been present before. There are always difficulties within the hospital community, whether it be debt or labor costs or whatever it might be, but something specifically to COVID would be my preference for the ARPA dollars.
And we could definitely do that because specifically we know that we were increasing ECMO capacity and increasing all of the surge capacity that we needed to do in order to serve in the Memphis area. I might want to continue to say that. So I'll dignify that specifically.
Okay. Councilman Jones.
Thank you. And Reverend Norman, you struck a nerve with me when you talked about this is just the Memphis portion of it. I would contend that nobody anticipates getting sick. And when we look at the poverty rate of people here in Memphis, their budget, they didn't budget for getting sick. And so the fact that this would part of it, and I don't know, I guess we haven't discussed or contemplated what would be the primary use of it. But if we're talking about helping alleviate some of the financial obligations that Memphians have, but not for COVID, they would not be facing these financial difficulties. I'm on board for this. Thank you, Mr. Chairman.
Thank you, Councilman Jones. And that is specific. You may have seen the recent data of $70,000 being an average cost of what people are experiencing for long-term stays in the hospital. And you realize that several months ago, there was a big uproar about suing people who had gotten sick. And we just chose not to do that. But even further, we wanted to go far enough to be able to help people who are specifically in the Memphis community alleviate their debt and not have this on their credit ratings as well as a axe hanging over their head. That's going to be a COVID-specific item.
Okay, thank you. Any other comments from council members? Questions? All right, this has been moved by Councilman Robinson. Is there a second? Or was it second or was it the motion or presentation? It's a presentation. We have a resolution in front of us that was. We voted on all of them. I'm just going to read the first one.
States, thank you, counties, cities, and tribal governments cover increased expenditures, replenish lost revenue, and mitigate economic harm from the COVID-19 pandemic. And the last whereas it was a member of the Baptist Memorial Healthcare team that personally escorted the first positive COVID-19 test case sample from Memphis to the laboratory in Nashville, Tennessee. Now, therefore, be it resolved that the city of Memphis allocate in the following manner: the $6 million, one to share the pennies, $1 million to Habitat for Humanity, third one to Mid-South Food Bank, and the fourth category actually is $3 million to the hospital systems. I so move.
Okay, moved by Councilman Robinson,
Second.
seconded by Councilman Warren. Any other comments or questions on this? All right, Ms. Hayes, will you please do a roll call vote on this resolution? A roll call vote, sorry. Surprised you.
Councilwoman Johnson. Councilman Ford. Councilman Jones. Councilman Carlisle.
Abstain.
Councilwoman Robinson.
Aye.
Councilman Warren.
Aye.
Councilwoman Swearingen. And Chair Morgan.
Chair abstains. All right, so that receives a favorable recommendation with 4 yes votes, 0 no votes, and 4 abstentions. All right, thank you all very much for y'all's time and for being here and for the work that y'all do. We are going to move on to the next presentation. I've just been notified that Explorer Bike Share, we have already heard from them and that they are being removed. Is that correct? Mm-hmm. All right, withdrawing from. So we will go to Orpheum Memphis next. Councilman Jones.
Thank you, Mr. Chairman. And colleagues, this is just keeping with the theme of addressing those organizations that bring people to Memphis, that help influence and help generate revenues for what will be the TDZ, as well as the hotel revenue. And so that looking at that, Orpheum is just one of those. There are a few more that have come before us, and so I'll turn it over to whomever be presenting on behalf of the Orpheum.
Good evening, everyone. My name is Dacry Baptiste, and I'm the Vice President and COO here at the Orpheum Theater Group. And apologies, my camera was working earlier, and now it's no longer working. Respectfully of everyone's time this evening, on behalf of Brett Batterson, the President and CEO of the Orpheum Theater Group, we are just honored to be considered to speak to the council this evening at this point, just about, I guess, how we've had our ups and downs throughout the pandemic and how we are working very diligently and vigilantly, should I say, to continue to be cognizant of the pandemic, and that we are an industry that has to bring people together side by side in order for entertainment to proceed on. Throughout the pandemic, we did as much as we could to exhaust our resources, losing 45%, if not more, of our operating general revenue, relying on various resources to continue to operate, really relying heavily on our education department to provide virtual programming to our constituents, our kids, as many communities as we possibly could while the pandemic was going on, even creating programming to present outdoors on our back parking lot, if you will. But now we're coming to a time that business hopefully is resuming. Broadway is back open in New York City, so therefore we know that Broadway should be open back here in Memphis, Tennessee. When we bring our performances and shows and events, if you will, to our venue, it doesn't just benefit us in our 4 walls, but it trickles out into the downtown area, to Beale Street, to the restaurants, to the hotels, just like it was mentioned before, I believe, in the Arts Memphis presentation. The Orpheum's impact doesn't just impact the visitors that are within our building, but also throughout our city. If we were granted funds to contribute to our facility and our business, if you will, we would use those to continue to upgrade inside our building, our 100-year-old building, ventilation systems. We would obviously bring in, those funds would help us support our PPE, be it masks or cleaning supplies, definitely more rapid testing to be done as we tread lightly on what's happening and bringing people together. And we also would have funds to hire more staffing, especially in our housekeeping areas, to maintain the cleanliness that is required as we operate in this pandemic. Again, I just wanted to keep it short and keep it brief. We're honored to be here, and I'm happy to take any questions that anyone may have.
Okay, thank you very much. Councilman Jones, and then I've got a question as well.
Can you talk about the number of missed shows that you all may have experienced during the pandemic? I know you indicated a 45% drop in revenue, but can you talk about, some of the shows that you didn't have because of the pandemic?
and how many days
Absolutely.
that equates to.
Absolutely. And what I'll do is I will kind of do 1920 so you can kind of see the comparison, if you will. In fiscal year 2019 for the Orpheum Theater Group, which ends on June the 30th, 2019, we had 768 events in that year from July 1, 2018 to June 30th, 2019. For fiscal year 2020, we had 340 events. So right there, that's about a 50% drop in events. The only way we sort of leveled out 20 the way we did is because we did have a lot of virtual programming, and we jammed in as much as we possibly could prior to the pandemic happening.
And so if we look at, I know you probably haven't closed your books yet for this upcoming fiscal year, but do you have an estimate of what that would be?
What's the question? What
the number of events? You know, we went from 768 to 340, but those were 19, 20. Do we have, I know you may not have closed out your books for this current fiscal year, but if we can get that indication.
No, for the fiscal year 20, so that would have been 2019 to 2020. So right, the pandemic started in March of 2020. We 340 events.
Right, but so what I'm saying is that
I'm sorry. I'm sorry, I stand corrected. Yeah. 256 events. We closed out 21 with 256 events. I apologize.
Okay, so you still didn't quite get back to, well, you didn't even get back to where you were for the previous fiscal year. Gotcha.
Not at all. Most of those events were virtual, thanks to our education department.
Okay, thank you. Thank you, Mr. Chairman.
Okay. So my question is along the same lines, but rather than just general events and revenue, what was y'all's net change in terms of your bottom line position? Because also the fewer events y'all have, the fewer expenses you have as well, just in terms of performing and putting on those and all the personnel that go into it. Because for a nonprofit like this, it's a lot more complicated. Y'all got revenues, y'all got expenses, but you've also got endowment and donations. So just in general, it's a, you know, if we're going to give you all $250,000, I think we got to be pretty open about the financial health of the organization. And I only go down this route because honestly, just by coincidence, I was having a conversation about the Orpheum this week, and somebody that was familiar with y'all's finances was bragging on, you know, actually how well y'all are doing, and really coming through this. And we were talking about some future city council business with the Orpheum building, but drifted into that territory. So that. Would y'all be willing to open the books and kind of give a fuller detail of, you know, the year by year breakdown of donations and expenses, more than just the events and revenue side of it?
100%, absolutely. We are a 50C3. We're a nonprofit organization, and our 990s are indeed public information. And it does go without saying, we have nothing to hide here as far as our finances. Again, being considered for these funds from this committee would be wonderful, but it goes without saying, it is publicly known that we took advantage of every opportunity that was provided to us over the pandemic to help sustain our business. That said, we did lose $1.7 million last year. Most of the programming that we did last year basically didn't generate any income, but we knew it was important to offer programming when we could safely to audiences. So to answer you, absolutely, we can get you anything you need.
All right, let's just follow up with that. Yeah, I'll abstain until I can see the math later. And just want to say I'm a big fan. I was averaging end customer. I was averaging 2 to 3 events before the pandemic, and I've already got my Lion King tickets for November. So very excited.
Thank you so much. We're very proud of that.
Any other council members? All right, seeing none, we'll go on to the next presentation. Thank you so much for the time and the work that you do. Stax Museum, Councilman Jones.
Thank you. Another organization that brings people to Memphis, and so for the representatives from the Stax, if you could make sure to delineate in your remarks the difference in revenues, attendance, and other experiences that you've had as a result of the pandemic would be helpful to the council. Good evening and welcome.
Thank you. On behalf of James Macklin, our board chair, the board of directors at the Soulsville Foundation, and the staff at the Soulsville Foundation, I want to thank you, Councilman Jones, and all the council members for having us tonight and staying with us this late into the evening. Really appreciate this opportunity to pursue this $250,000 potential investment in the Stax Museum of American Soul Music, one of the most important spots and places in Memphis. My name is Richard Greenwald, and I'm here maybe with my colleague Jeff Kolaf. He had a family issue to attend to as this went on. So if he's not here, I will cover his portion of our short presentation and certainly answer questions the best we can. I am the president and CEO of the Soulsville Foundation, and Jeff is the executive director of the museum. The Soulsville Foundation, just for the record, Councilman, operates the Stax Museum of American Soul Music, the Stax Music Academy, and the Soulsville Charter School, all on the campus that hosts the original site of Stax Records. That's such an important business and artistic expression and center of probably one of the most important art forms that ever came out of Memphis, which is American and Memphis soul music. Our mission is definitely to preserve that legacy of Stax Records, a company that was doing corporate social responsibility before that was even a term, and it had such a dramatic impact on music in the world and certainly on our city. We consider soul music as really the brand of Memphis, and we epitomize that in everyday work that we do, educating young people and preparing the next generation of artists, for sure. Just couple other quick things about the Soulsville Foundation in general and the campus in South Memphis at the original site of Stax Records. We are a Memphis community-based organization, and certainly we have national and international reach, like you heard the National Civil Rights Museum discuss earlier. You may have seen Memphis represented and the Stax Museum of American Soul represented during the presidential inauguration. President Biden and Vice President Harris this past January. Justin Timberlake and Aunt Clemens performed at the museum during the inauguration, and they included our students from the Stax Music Academy, which was very exciting for us, and I know for Memphis. When we did that, when we were on the Ellen holiday giveaway show a few years ago, I know Memphians were exceedingly proud of us representing this city, and even had watch parties around it, and we were thrilled to play that role. You may know that we average in a non-COVID year over 60,000 visitors a year. So to reiterate what Arts Memphis said, national civil rights, et cetera, that means economic potential for the city. We are a driver for sure in Memphis, and what you may not know is that in our gift shop, we try to locally source all the merchandise that we can that we sell in our store. We have over 7,000 kids in a great year and a non-pandemic year from the Shelby County school systems that will come to our museum. Maybe the first time they've ever been in a museum, they'll experience the Stax Museum of American Soul Music. And of course, we are in collaboration with our Music Academy. That's an out-of-school program. We do 40 nights of programming a year in a non-pandemic year, and those programs are free to the public, and they span interest and opportunity, which is what Soulsville is all about. It's all about the threat of opportunity for young people and for artists. We absolutely collaborate with others in our community, so everything that we do, that the investments like this, potential investments, certainly have an impact on what we do, but they impact our community in South Memphis in the neighborhood known as Soulsville, USA. You may be coming to the Soulsville USA Festival in a couple of weeks, and that'll be held on our campus, but that's in collaboration with others in our community. We don't run that festival. We just allow people to use our campus for things like that. And finally, I want to say about the museum, it's not something to be taken for granted. We've worked exceedingly hard to have the impact we've had on our community, and we're grateful for people like you who know that and care about our future. We also have a proven business model. And so our museum and our gift store have been successful and have, except for during COVID, have been successful year after year. And we know the more that we invest in the museum, which is now 20 years old, and we've learned a lot about the story of Stax that needs to be updated, including the role of women in the story of Stax, including what happened after Martin Luther King was assassinated in Memphis and what happened after Stax closed. We know that any investment in our museum will definitely have an impact on guests in the future and the economy of Memphis as a whole. I'd like to say just a couple of quick things. We have more of a statement here, but I'm realizing that we really want to be sensitive to time. Just a couple of key points that we were definitely down, like most. Let me just pause for a second. Jeff, are you on the line by chance? He is not. I just want to say a couple of things then. The earned income and admissions and merchandise sales were down around between 70 and 75% during the last fiscal year. It was pretty dramatic. And that was like most museums around the country. Our museum canceled or postponed nearly all our in-person events. That is what Memphians love. Besides just the museum in general, they love the 40 nights of free programming that we do. That was a loss of, the free programming, but the events that we also host that people pay for and rentals, we lost about $40,000 in revenue during COVID. We also, of course, lost the opportunity to do all those things that I mentioned before. The APRA funding from the city of Memphis could be transformative for the Stax Museum of American Soul Music in several ways, all ensuring our long-term sustainability of the museum. It would definitely help us recover and help us recover more quickly so we could do more in Soulsville, USA and in South Memphis. Specifically, some of the projects that we are investing in, we would like to invest in, that we're planning around, are improving our outdated technical infrastructure, including new video screens, sound systems, and interactive displays for learners of all ages, new design and written text panels that update the story like I mentioned before, an updated museum introductory film. And for those of you who love our introductory film, don't worry, you'll still have access to it. But we need to redesign the lobby, the museum store, the ticketing area. We need to expand the theater so we can host more events. As you may know, there is no event space in our neighborhood in much of, not just Soulsville, but in much of South Memphis. We don't even have a place to perform or for our students to gather. So the more we can even expand a smaller space to allow some public events in addition to our own would behoove us all. So I thank you for this amazing opportunity to present in front of you. We are grateful that you would consider this proposition of this investment.
All right, thank you very much. Any questions or comments from council members? Councilman Jones.
Thank you. Ms. Greenwald, you talked about your museum sales. Can you talk about your overall change in financial position from as a result of the pandemic?
Yeah, I'm going to speak in generalities, but while we had a dramatic impact to our funding, just like the Orpheum, we did take advantage of some of the public funds that we could, but we were down over 70% in earned revenue. And so that is, that earned revenue is, we raise money in two ways. One is traditional development money, grants, individual giving, et cetera, and the other is earned revenue. A lot of nonprofits can't earn revenue. We do through admissions in our gift shop. That was down almost 75% really during the fiscal year 21, and that's almost half our budget. So we were impacted. We had about a $3 million budget that year, and losing 75% of half of that was painful. However, I will note, we were very prudent and we cut expenses in a very prudent way. We did not furlough or lay off any of our employees, and I'm glad we didn't. And I don't say that because we were irresponsible. We did it in a very responsible way, but everybody has kept their job.
Thank you.
Sure, that's all I have.
Okay, thank you very much. Any other comments or questions? See none, we're going to go on to the next presentation. Thank you so much for your patience and sticking with us this afternoon.
Thank you so much.
Southern Heritage Classic, Mr. Fred Jones and Councilman Jones.
Thank you, Mr. Chairman. Welcome, Mr. Jones. I wasn't able to attend the Southern Heritage Classic this year, but the fact that you had it was a big difference from the previous year. And going back to comments that I've made about all the ones that I have presented before my colleagues is that I wanted to help those organizations that bring people, that attract people to Memphis, people who come from the Southern Heritage Classic. They most often do not make it just a one-day event. So this is definitely an event that helps generate revenues for our hotel, motel, revenue funds and other auxiliary businesses that are patronized when people come to this event. So, Mr. Jones, the floor is yours. You're muted. Okay, there you go.
I'm glad I followed Stacks because Stacks is where I got my start in the entertainment business more than 50 years ago. Yeah, I'm that old, so most people don't realize that. The Southern Heritage Classic started that in 1990. It has become the premier sports entertainment event in Memphis with an economic annual impact of $25 million, according to our last survey in 2019 by the University of Memphis. It is clearly a revenue, economic engine for the Memphis and Shelby County. And we got shut down in 2020. And this people talk about lost revenue. We lost everything because we didn't play. I mean, there was no Southern Heritage Classic in 2020. And 2 years before that, in 2018, we played all the events except the football game, which was shut down. Well, it started at a quarter, about 15 minutes before the start of the game, and we finally shut it down at 10:30. But all of that revenue from the game, which is more than $750,000, had to be refunded. So it's been a painful last couple of years for the Southern Heritage Classic as an event. And this year was a very precarious position because it was my firm belief that if we had not played or presented the Southern Heritage Classic this year, then that maybe have been the end of it. It wasn't our fault, but it was just would have been the hand that we were dealt. And fortunate for us and blessing that we were able to play the event and play it in grand style. But for business people, you can't make up these losses or these shortcomings in one trip. It's over a period of time. And what I want to do going forward, and any funding that I get from City Council, let me say this, if it wasn't for some of the available funding that was available to us along the way to keep my staff together, it would have been very, very, very difficult to make a comeback. And we didn't even get a really good start this year because we didn't go on sale to the football game until May. And there still was doubt because of COVID. We still was having conversation all the way up until the last couple of weeks about what the protocols were going to be. And although I work with the city of Memphis and the Shelby County Health Department in advocating for take shots, wear your mask, but that's something that we had to work real hard with. And I have to say that the people of Memphis and the people that came to the event reacted accordingly. And that's why we were able to do it. But financially, over these last several years, it's been pretty difficult, but with, careful management, and awareness and support where we could get it, then we were able to sustain ourselves, allow us to get to this year and have a spectacular event. Financially, you don't, as I said earlier, you don't recover from those kinds of losses or setback in 1 year. You're down 1 year, you play down completely the next year. And you play this year, and in spite of saying, oh my God, I mean, everything is back normal, but it doesn't work like that. All business people understand that. So whatever funding that I can get from City Council, I intend to take advantage of what we have right now going for us. And that with this event, with the 2 all-star coaches on both schools, the great presentation that we had this year, being on ESPN helped tremendously. So we got to take advantage of that with a great presentation, a different presentation, and we got to come full forth in terms of how we're advertising and promoting. Now we got a national platform. We need to be able to put things together to take advantage of that. So thank you for your time. I take any questions that you may have. Luckily for us, a lot of people like what we have going on in Memphis with the Southern Heritage Classic.
All right, thank you very much. Any comments or questions from council members? Okay, we're going to go on to the next presentation. Thank you for sticking it out with us. Africa in April. Mr. Acey and Councilman Johnson.
Okay, it's Mr. Acey on? Yeah. Thank you. Colleague.
Hello?
Yes.
Yep. We can hear you, but yeah, we can hear you, but no video.
I'm trying to get it. I don't see it. Video, camera. Oh, there we go.
Now you go. Allow me, Dr. Acey, just to introduce you before you begin. The grant that I'm asking and seeking on behalf of Africa in April is $150,000. That amount will be used to help rebuild the Africa in April economic. We talked about recovery as a result of COVID, what is needed in order to come back. It's obvious that Africa in April has obtained international recognition. At the same time, the services which they provide are not only educational, but as far as revenue as well for the city. So this time, I'm just going to let Dr. Acey tell you more about Africa in April, how COVID affected him, and if funds were made available to him, what he would actually do with those funds. Thank you, Dr. Acey.
Thank you very much, Councilman Johnson and council members. Appreciate y'all having us on. Well, I know we're rushing and you're saving the best for last. So the pandemic really affected our bottom line. In 2020, March of 2020, I had prepared for the festival, had rented all the equipment, had my vendors coming, they had paid me to come to be a part of the 2020 festival in April. We had everything set up. And then we could not produce the festival because of the pandemic in March. So I lost all the revenue that we would have generated from our ticket sales. Our vendors had already paid me, and they asked for a refund to send the money back to them. So I lost that money. I did send it back because they had been with me 15 years. The craft vendors, the food vendors, I lost all that revenue, plus all the things I had rented, put the fence up and security for the 2020. I lost over $80,000 and $90,000 and didn't recover a dime. So in 2021, with our little reserve funds we had, we intended to produce the festival in 21. Once again, the health pandemic, like Fred Jones said and others, have really handicapped us. and we could not produce it because we couldn't get the permits, we couldn't get the health permission to produce the festival. So that's 2 years. So our committee said, well, we need to do something. As Fred Jones said, we got to keep this entity going. So let's have Africa in April and August. So we decided to have Africa in April and August in 2021, knowing that the pandemic was still there, the health restrictions. So I'm happy to say that Dr. Randolph and the health providers did come, and we asked them to come and give away shots at the festival. They did that. The University of Tennessee came, the health science people came and provided all free health information. Homeland Security provided us with some masks and some hand sanitizers. But my revenue, because people were still afraid to come to an open event. So we lost 60 to 70% of our audience. And that's where we get our revenue from, plus the food vendors and the craft vendors and sponsors that give us a little money. But most importantly, we lost, and the city lost $2.5 million because each year the festival generated a $2.5 million economic impact during regular time. So we lost all of that, and we did have the festival in August, the first week in August. So we were really impacted. One of our sponsors, I won't call the name, for the first time was going to give us, they gave us $20,000 as a presenting sponsor. And then we couldn't produce the festival. So they respectfully asked for the money back, and we sent it back to them. So we lost during 2021, and now for trying to prepare for 2022. So we need $150,000 for sustainability. We had to reduce the staff by three, but we didn't fire them, you know. But we got to come back, but we need the money. We had the Memphis Police Department down there doing recruiting, and Memphis Tourism and the University of Memphis said that African April generate at least $2.5 million economic impact for the city of Memphis. And we're moving toward 35 years. It'd be 35 years of African April, generating all that money for the city of Memphis, getting $20,000 that they used to give us, a 10, a 5, but this is an investment for the city. And it's well known, it's well liked all over the world, international. And I guess my caveat is this. In July of this year, a group of us, along with Reverend Leo Gray, came up with the idea that we needed to put a How to Be Well statue right at 4th and Beale Street to help tourism and economic development. So we got with Kevin Kane, didn't ask the city for no money. We raised $250,000, and that statue is right there now. That's going to drive people all over the world to Memphis, Tennessee. That is our purpose, and we help the homeless. I pay them at night when they clean up, and the health department said we have the cleanest festival going, and I pay them cash because they can't take a check. So we can't calculate those things in what we need to continue. But we need the money because we got to keep it going, and we got to make 35 years and beyond, like Fred Jones said. And I had to honor my musicians that I had to pay them half of the money. They said, if you don't have the festival, you can't get your money back. So you all understand that. So we took a big hit, and hopefully the city council will see that it's an investment, not just a grant for us, but for the homeless and for all the collaboration we do with Arts Memphis and the health facilities, Seniors Day, education, and we mentor the whole year. And our office is in 106, area code 106 over there by Stacks, and we help the people there during the whole year and mentoring, et cetera, et cetera. So appreciate anything y'all can give us and help us sustain the African April Festival, Cultural Awareness Festival, celebrating through the windows of the arts.
Thank you very much. Any comments or questions from council members? All right. Seeing none, we appreciate you hanging in there with us and your patience and the work you do. Council members, we do have one more presentation. It is the Memphis Midtown District Collaborative. That was requested by
I just wanted to make sure you know that I will submit a resolution come Tuesday.
Okay.
Thank you.
Yeah. Is the Memphis Midtown District Collaborative, is requested by Councilman Ford and Councilman Easter Thomas, and they are requesting $500,000. I believe we have Rory Thomas on the line.
Yes.
And Councilman Ford, do you want to introduce this, or do you want to go straight to Mr. Thomas?
We can go straight to Mr. Thomas.
All right. Mr. Thomas, if you just introduce yourself and your position, and then the floor is yours for presentation.
Thank you so much. Well, good evening, everyone, and thanks for having me. I'm Rory Thomas, the new president of the Memphis Medical District Collaborative. So about 100 days into the organization, and our organization is made up of the healthcare institutions, so Regional 1, Methodist, St. Jude, Southwest Tennessee Community College educational institutions, UT as well, where these institutions have come together to really try to make the medical district a more vibrant, prosperous, and equitable community. And hopefully since 2016, you all have seen some of the improvements that have taken place within the Memphis Medical District. So we have a major focus on really trying to make it a great place to work, live, learn, and play. And what we've done since the pandemic, we have a big focus on building community wealth and really working within residents of the medical district. So there's about 11,000 residents in the medical district, 67% African-American, about 43% live below the poverty line, and only 10% of homes are owner-occupied. So basically this model is using our institutions, healthcare institutions, and educational institutions as economic engines to really have a great impact on the community. And something that we've been focused on is, of course, attracting new, small, and diverse businesses into the medical district, but really working with the residents in the areas, zip codes, to get them jobs at these anchor institutions. And of course, given the pandemic, everything that is going on, our healthcare institutions are in major need of workers. So we have programs such as Hire Local that we're really branching out into a lot of different zip codes to recruit residents, train them up, but also provide them essential skill training and other training as well to really make them get opportunities at the hospitals. And once they're completed with the program, they're guaranteed interviews, and we have a 71% placement rate. And then once they're in those jobs, there's also a career ladder approach. So if they're a CNA, which is, everyone is hiring for right now, we're providing stipends and continued training for them to become LPNs as well. So some of the things that we've focused on during the pandemic is really providing assistance to the businesses. We had 31 new businesses moving to the medical district within the first 5 years. And so we provided about $190,000 in grant funds to help them remobilize and stay open. And also for the residents that we've been working with and those new hires through the Hire Local program, we provided just rent assistance payments and other services to help them during the pandemic. So, and also the fact of giving with our anchor institutions, a lot have, had some revenue issues as well, which has affected our organization. So colleges enrollments have dropped, and hospitals not able to do enrollment elective surgeries as well. So that has led to some of the revenue drop with our organization. But any support that you can provide can really help us, bounce back as an organization and really have an economic impact for years to come. Within the medical district and really throughout the city of Memphis, because we know the medical district, it really touches everyone at some point. So that concludes it all, and thanks for the invitation. I just got back on a flight from Philadelphia and got the call, so really appreciative of your time and opportunity, but open for any questions or comments.
Yeah, thank you very much. And I misspoke when I said the Memphis Midtown District Collaborative. It is the medical district. I've got Midtown in my paperwork, and I was confused. I was like, how did they not come to me? And Ford and Anisha Thomas are the reps. But this makes more sense. Any comments or questions from council members on this item?
I just want to say there will be a resolution.
Okay.
That's all.
Okay. I think we're going to have a lot of resolutions on Tuesday. I'm going to request that we also hear this in executive, since we already have had some resolutions that will be on the agenda for the downstairs meeting. Executive is a place where we can change or amend the agenda or add things onto it. And so I think it's actually going to end up being more fitting for this discussion than the budget committee, but we can certainly use time in budget committee to discuss as well. I'll have to talk to Chairman Colvett about that and get him to sign off since it is his committee. But that would be my recommendation. And it may be, if you include Methodist, La Bonner, $45 million in requests, that maybe the majority of the council really only feels strongly about $30 million of the request. And the fairest way to get from 30 million to 20 million would be to, percentage reductions where somebody requested $1 million, but we just can't get them $1 million and get everybody else that we want to give to the money that they requested. So we have to go back down to 650,000 for that organization instead of $1 million. That might be a path forward for us to be able to fit all these requests into the $20 million budget line. So that is one thought, but open to other thoughts from council members. Thank y'all for patience and time, and for staff for sticking with us. Andy, this is it. This is our last committee meeting. So thank you. Any other business for this committee?